All right. Perfect timing. Good morning. All righty. Good morning. Good morning, everyone. I am at-large Council Member Anita Bonds, Chairperson of the Committee on Housing and Executive Administration. The time is 10:15 a.m. on Monday, February 14th, 2022. Happy Valentine's Day. We're meeting virtually via Zoom to convene a public hearing on Bill 24-0419, the No Senior Hungry Omnibus Amendment Act of 2021, which was introduced by Council Members Shea, Trayon White, Pinto, Lewis George, Henderson, Gray, Allen, and myself on October 1, 2021. This hearing is also streaming live and recorded on the committee's YouTube channel named HEA Committee. Although this pandemic has highlighted the pressing issue of food access and security in the district and nationwide, it is not a new concern here in our city. As much as we have done and continue to do since this pandemic, we recognize that we still have neighbors who are hungry. And I hope to identify areas of success and improvements, particularly relating to nutritional services. According to a recent report of the State of Senior Hunger in America, Feeding America found that the rate of food insecurity among seniors in the district is 14.3%, which accounts for approximately 12,000 of the district's senior population. One of the solutions to improving food security is not to only provide food access, but also increase the public awareness that resources are available within the means to get to those resources. In the past and presently, many people have not connected to the government in one way or another and are not aware of the many programs and services that are funded to serve the community. Accordingly, this legislation takes on a comprehensive approach to address senior hunger in the district. And I might add, it is a very important issue and one that my colleague, Councilmember Shea, has championed throughout her career. One, it establishes a senior nutrition service communications plan by July 1, 2023. It improves the implementation of nutrition programming by screening clients for food insecurity and malnutrition, while also taking into account the client's meal preparations ability and access to groceries. It establishes an interagency senior food security task force of at least 13 members that will be led by DACL, the Department on Aging and Community Living, to regularly evaluate the district's programs and policies related to senior food insecurity, which shall advise and guide the mayor, the council, and the agency on programs and policies to address food insecurity. It amends the Food Stamp Expansion Act of 2009 to require the Department of Human Services to allow expanded access to the SNAP enrollment system. And it adopts the elderly simplified application process by including a standard medical deduction for SNAP applications and developing senior targeted outreach and communications for online SNAP. It amends the Healthy Tot Act of 2014 to require the Office of State Superintendent of Education to provide outreach to adult daycare centers eligible for child and adult care food programs. And it amends the Department of Health Care Finance Establishment Act of 2007 to require reimbursable services under the EPD Medicaid waiver to include home delivered meals, nutrition supplements, and medical nutrition therapy. Specifically, this program by the July 1, 2023 date shall include description of the outreach needs of the food insecurity senior community and best practices for communicating such need, root causes of food insecurity, risk of food insecurity, and unique needs of each category. Discrimination of information about all senior nutrition services provided by the district, including annual mailer and information on enrollment processes that is tailored to the recipient's geographic location. Conducting an annual training for all senior facing district employees and community-based organizations, and outreach to physicians and clinicians serving seniors so that they can provide appropriate referrals for patients. And it also includes updated website and application portals for senior nutrition services using best practices for senior-facing technology that accounts for technological savviness of the population being served. All task force members will be selected by the mayor and shall include, of course, the Department of Human Services, the Department on Aging and Community Living, the Department on Healthcare Finance, DC Health, OSSI, and the Office of Food Policy. 4 members from organizations serving seniors, including at least one with expertise in nutritional needs of seniors, and 2 members who are seniors currently participating in nutrition services who shall receive a stipend for their participation on the task force, and 1 member from the Food Policy Council. In expanding SNAP, the Department of Human Services is required to allow CBOs to engage in outreach and enrollment on behalf of the SNAP participants, which the Department of Human Services may either certify the CBO or allow SNAP participants to designate a proxy. Adopt the Elderly Simplified Application Process from the USDA's guidance document of January 1, 2022, and create a standard medical deduction by January 1, 2023, streamline the process, and implement senior targeted outreach for online SNAP, including assistance with online ordering. As it is titled, clearly this is an omnibus piece of legislation aimed towards a comprehensive approach at starting to resolve this very serious issue. I ask that you keep your remarks to 3 minutes or less for individuals and 5 minutes or less for organizations to allow all of our important witnesses to be heard today. And with that said, I note that I want you to know as witnesses that your entire testimony will be a part of the record. So please remember to submit it, and you can email it to housing@dccouncil.us. At this time, I would like to recognize my colleagues who have joined us for this important hearing. And I want to start first with Councilmember Mary Shea for an opening statement if she would like.
Thank you very much, Chairperson Bonds, and thanks for having this hearing. I was very pleased to introduce this bill along with my colleagues, you, Councilmember Bonds, Councilmember Gray, Louis George, Alan Henderson Pinto, and Trayon White on October 1st, 2021. The COVID-19 pandemic has brought increased attention to the pressing crisis of food security, food insecurity in the District of Columbia and nationwide. But this issue far predated the pandemic, particularly among our seniors. In its most recent report, The State of Senior Hunger in America, Feeding America, as you mentioned, Councilmember Bonds, found that the rate of food insecurity among seniors in the district is 14.3%, which is the highest rate of food insecurity among seniors in the entire country. That means that even before the pandemic, nearly 12,000 seniors in the district lack consistent access to enough food for an active, healthy life, which is our definition of food insecurity. We know that seniors have higher rates of food insecurity due to a number of things: fixed incomes, heightened barriers to accessing food, increased rates of isolation, a very important issue, and other causes. And we also know that food insecurity has heightened consequences for our seniors, who are more likely to suffer from chronic health conditions that require adequate nutrition for management and prevention. The district has many programs in place to address senior nutrition, but food insecurity rates remain high because many at-risk seniors are unaware of the available services or have difficulty accessing them. Existing senior nutrition services often provide limited or no outreach, and the district government does not collect data on which seniors are food insecure and who is accessing services and who is not. And while many agencies play a role in providing senior food services, there's little or no coordination between these agencies and their programs. As a result, we have far too many seniors falling through the cracks. This legislation does take a comprehensive approach to addressing senior hunger in the district. First, it would create this intra-agency senior food insecurity task force made up of relevant agencies and non-governmental organizations serving seniors. It would be charged with developing a district-wide response to the senior food insecurity and coordinate agency action and maximize effectiveness and our reach of services. It would also require a district-wide communication plan for senior nutrition services to ensure that all available resources and avenues to connect to isolated seniors in need of programming or support are followed. The legislation would also require the district to take several steps to increase SNAP participation among seniors and add home-delivered meals and medical nutrition therapy to covered services under the medical waiver for the elderly and persons with disabilities. This legislation represents a crucially important step toward eradicating senior hunger in the district. It was drafted with significant input from community-based organizations serving seniors in the district, and it was informed by 6 months of working group meetings attended by these organizations, as well as staff from district agencies serving seniors. I believe this bill, which I hope will get swift passage, will ensure that we maximize food assistance resources for our seniors, and I look forward to working with this committee to move forward this important legislation. Thank you, Councilmember Bonds.
Thank you very much, Councilwoman Shea. Do we have any other? All right. Okay. All right. Well, we are ready now to receive our first panel. Okay, thank you. And we'll be attempting to do panels of 5 individuals. Okay, Alexander Moore from DC Central Kitchen, Winnie Huston from Food Policy Strategist, DC Greens, Miss B. Evans. All right, Beatrice Evans, Becca Khan, Nutrition Service Director for Food and Friends, and Brittany Kitt, Associate State Director, AARP DC. And I believe we have everyone here.
Ma'am.
I see, instead of Brittany Kitt, we have Virgil Young Jr. Thank you. You can begin, Mr. Moore, when you are ready.
Honorable Chairperson Bonds, Councilmember Shea, members of the committee, thank you for convening today's hearing, and happy Valentine's Day. My name is Alexander Moore, and I am testifying today on behalf of DC Central Kitchen. Like many of the organizations represented here today, DC Central Kitchen has decades of experience addressing hunger and poor health in our city.
Okay.
We've also been a firsthand witness to the staggering shifts in food insecurity in our community during the pandemic. And we are tired. We are tired of the seemingly endless food emergency facing too many district residents. And we are tired of seeing DC consistently sit atop the nation in our rates of senior hunger. During the pandemic, DC Central Kitchen's community-based nutrition services expanded by 87% over 2019 levels. Nearly half of this increased demand for services was from older adults in our community. In addition to our typical approach of providing healthy meals to partner nonprofits and local agencies, We received feedback from residents, many of them senior citizens, that fresh and nutritious groceries were of particular need. We responded by creating a grocery assembly program so large that it needed to move into the Washington Convention Center. Our fast-growing Healthy Corners program, supported by DC Health and the USDA, ensures that fresh and frozen produce is on the shelves of corner stores in neighborhoods where seniors cannot easily access supermarkets, and that SNAP customers can expand their purchasing power when selecting our fruit and vegetable offerings. The efforts of my frontline DC Central Kitchen colleagues in bringing millions of meals, grocery bags, and Healthy Corners products to DC's older adults are just one small part of a larger ecosystem. We applaud the efforts of the Department of Aging and Community Living and its lead agencies, the role of public nutrition programs like SNAP, and the dozens of nonprofits and mutual aid networks that have stretched far beyond what anyone could have reasonably expected of them in March 2020. From the outset of the pandemic, this city relied on its rich network of food-focused organizations and experts, and in doing so, averted a major disaster. On a near daily basis, public agencies, private nonprofits, and local advocates coordinated their efforts, identified areas of need, and shared resources. This level of transparency and trust was a credit to the council and the mayor's years-long investments in local food policy leadership. And absent these interagency and intersectoral collaborations, the district's food security crisis would have been far, far worse. These partnerships are ones we should learn from and invest in going forward. Senior hunger is often referred to as a hidden form of hunger. We support No Senior Hungry because it brings transparency and visibility while building on what we know works. The Act's call for an interagency food security task force prevents a backsliding to pre-pandemic silos and responds directly to the cracks between services that disproportionately affect our older residents. The Act's focus on age and culturally appropriate communication and outreach is critical to putting our existing resources to good use while overcoming the stigmas and technology barriers we know keep seniors from getting the help they need. The Act also works to creatively leverage available federal resources while creating space for local organizations and older residents to have a say in solutions that will work in our unique context. Finally, the Act's call for an annual progress report will create a shared understanding of the real issues at hand and ensure everyone involved in this work is accountable for their contributions. We need to act on this bill because we face a pivotal moment for seniors. Much of the Great Resignation is better described as a great retirement, as 90% of the Americans who are opting out of the labor market are over age 55. This early exit from the workforce, compounded with rising costs of living, diminished savings, and elevated health concerns, could easily become a perfect storm for senior hunger, a storm that could go on for decades. DC has a model of how thoughtful legislation can spark enduring collaborative work to drive lasting changes in our food system that reduce hunger and improve public health. We've seen it in our schools through the Healthy Schools Act and the many partners who have helped make DC a national leader in school nutrition over the past 12 years. No Senior Hungry builds on that same set of principles while centering senior voices and relevant experts. Madam Chair, we don't have to lead the nation in senior hunger anymore. Today, we can choose to lead the nation in solving it. Thank you for the opportunity to testify today. I'm happy to answer your questions. Thank you.
Thank you very much for your testimony, Mr. Moore. It's Ms. Huston with us. Oh, all right. Welcome. Good morning.
Good morning, council member. I apologize. I was having some technology problems. So
It's
happy
okay.
Valentine's.
We all know what that means.
Happy Valentine's Day.
Same to you, most definitely.
Councilmember Bonds, committee members, and council staff. I am Winnie Houston from DC Greens, a district nonprofit that works to promote health equity by building a just and resilient food system. I am here today to speak in support of the No Senior Hungry Omnibus Amendment Act of 2021. Senior food insecurity is a persistent and growing problem that is negatively impacting the health, quality of life, and independence of DC seniors. The latest data shows that DC has the highest senior food insecurity rate among US states at 13.5%, an increase from 9.6% in 2016. Although we don't have a complete picture of the impact of the COVID-19 pandemic on senior food insecurity, we do know that seniors are using nutrition services at a higher rate than before the pandemic. Research shows that the number of DC seniors facing food insecurity will grow in the coming decade, as the senior population is expected to increase by over 20,000 by 2030. We must work as a united city, government, private sector, and community members to put our arms around this situation and build systems to address this crisis facing too many seniors. In early 2021, Councilmember Che convened a working group of council and government agency staff, community members, public health officials, and nutrition providers to better understand the successes, challenges, and barriers to combating senior food insecurity. Those discussions informed the creation of the No Senior Hungry bill before this committee. During this time, we learned that there was no agency with the responsibility to address senior food insecurity. No one was in charge. Little or no coordination between agencies providing nutrition services, limited or no outreach about available nutrition services, no data on how many seniors in each community or ward are food insecure, how many of those seniors are accessing services, or if the services are meeting the needs of seniors. No plan to reach seniors who are not already connected to services, and no comprehensive strategy to increase senior participation in programs like SNAP, adult daycare services, or Medicaid-funded home-delivered meals and nutrition services. Based on conversations with seniors and community leaders, I offer the following recommendations. We must implement strategies to provide nutrition services to the LGBTQ community, residents who are not fluent in English, including our deaf and hearing impaired neighbors, and seniors who have religious and dietary needs not served by traditional nutrition programs. Partner with our faith community and other trusted neighborhood leaders to develop programs and services to reach seniors in all neighborhoods. Develop, improve, and publicize transportation services for seniors. Increase SNAP benefits for seniors. Simplify the process for eligible seniors to receive public nutrition benefits, and solicit input from seniors themselves on how best to improve services. Madam Chair, I will end my testimony by asking you and the members of this committee to listen carefully to the witnesses who are sharing their stories and think about how you would handle the situation if you or your loved ones were food insecure. Let's work together as one city, government, and private sector to say no more hungry seniors in the District of Columbia. Pass the No Senior Hungry Omnibus Amendment Act of 2021. Thank you very much.
Thank you very much for your for your testimony. We'll now turn to Ms. Evans. You're on. You have to unmute your computer system, all righty. Or your phone.
Okay.
All
Can
right.
you hear me now?
You're on. Yes, thank you.
Thank you. Oh, great. Thank you. Good morning, Councilmember Bonds and Chavez. Thank you for holding. Good morning. Thank you for holding a hearing for the No Senior Hungry Amendment Act. As I said, my name is Beatrice Evans. I'm a native Washingtonian, and I'm representing the seniors of Triangle View Senior Building. We're located here in Ward 7. I heard you say, Chavez say something about enough food. I'm speaking more to the quality of the food. When I think about nutritional foods, I imagine fresh, appetizing, healthy fruits and vegetables like apples and melons and kale, cabbage, not rice, cereal, and canned goods. A lot of the seniors in my building have diabetes, high blood pressure, as well as other health issues. I want to know how this legislation will improve the quality of the nutritional foods that you serve us. I know that DC has a surplus of $570 million, and this surplus can be used to improve our access and to the healthy foods. And I have about 4 priorities. I suggest that you give seniors more food stamps so they can buy their own groceries. You should provide free transportation. What's happening? Go ahead, keep going. You should provide free transportation for all seniors, or partner with agencies who will come to us, like Bread for the City and Hunger Solutions. We're in a food desert because there's only 3 full-service grocery stores in Ward 7 and 8. And you can make sure that any organization or vendor receiving city dollars only provide quality goods. Some service organizations are providing unripe, wilted, hard vegetables and fruit. Others are providing prepared cooked foods that are not tasty at all and have the same menu over and over. These organizations should follow the example of Bread for the City, their food delivery program. What a variety they have. They give us meat, butter, and the fruits and vegetables are always fresh quality. Lastly, I think we should invest more in teaching seniors how to use their EBT cards to purchase groceries by phone or have it delivered to from stores like Giant, Walmart, and Amazon. And if you need examples of the lack of quality we get here in Ward 7, I will be happy to answer your questions. I have pictures. This committee and related agencies should seek regular feedback from us seniors about the service you are providing for us. The organizations you partner with, you should work with the tenant associations, the organizers, the leaders, and just seniors living in these buildings to understand the reality of hunger. Unfortunately, we rely mostly on flyers and word of mouth to share information. I urge this council to pass this act and ensure these ideas are included. Also, your number 28, Ms. Common Leader Lacey, will address other issues we are concerned about. Thank you for your time.
Well, thank you very much for your testimony. We'll now turn to Becca Khan. Welcome.
Good morning. Thank you.
Morning.
I am Rebecca Khan, a registered dietitian and the Director of Nutrition Services at Food and Friends. I would like to thank Councilmember Anita Bonds and the Committee on Housing and Executive Administration for holding this important hearing and allowing me to speak.
Okay, so what's wrong with my mute then?
I think I'm just going to wait for, I think there's somebody
Yes,
still.
yes. Miss Evans, could you mute your
I think she's muted now.
Okay, all righty. Please
Okay.
continue. I'm sorry.
No, that's all right. So I am here speaking on behalf of Food and Friends, and the mission of Food and Friends is to provide medically tailored meals to improve the lives and health of DC residents living with serious illnesses, such as diabetes or cancer, kidney failure, HIV and AIDS, and other conditions that ultimately limit their ability to provide their own nourishment. 30% of those we serve are seniors. And this No Senior Hungry legislation is going to provide life-saving benefit to those members of the community, and it ultimately has the full support of Food and Friends. The establishment of an interagency senior food insecurity task force will ultimately achieve the following: ensuring regular communication among senior providers, provide coordinated nutrition care for our seniors, rescue seniors from falling through the cracks, and serve more seniors with customized programs that are the best fit for them. We support expanding the services in the elderly and persons with physical disabilities waiver to include home delivered meals, nutrition supplements, and medical nutrition therapy, or MNT. DC is currently one of only 10 states that has not done so. This expansion will allow our seniors and people with disabilities to thrive and have ultimately an improved quality of life by remaining in their homes to receive the care they need, including nutritious food, supplements if they need it, and that MNT. Seniors will benefit from regular counseling, which includes detailed explanations of how their illness or illnesses and/or the medications will be impacted by the food they eat. As any of us age or are diagnosed with new illnesses, such as diabetes or kidney disease, or we're put on a new medication, our food needs necessarily change. DC seniors and people with disabilities should be allowed to access nutritious food and understand how best to prepare or eat the food given their specific health conditions or medications. This legislation, and specifically expanding the EBP waiver to include home delivered meals, nutrition supplements, and MNT, would allow DC residents to remain in the comfort of their own homes while accessing the food and information they need to remain as healthy and happy as possible in those homes. To illustrate the importance of those home delivered meals and MNT, I want to share a story about a recent conversation I had with a Food and Friends family. An adult child taking care of a senior parent told me that their parent was hospitalized before receiving Food and Friends meals. They were then sent to a rehab facility where she declined food and stopped eating completely. The medical team told the family to prepare for the worst and take their loved one home to be comfortable and not to expect much food intake. The medical team at the rehab facility referred that family to Food and Friends, and since receiving home delivered meals and nutrition counseling from us, our client has started eating again, enjoying food, and has spent quality time with family. The intervention undoubtedly brought nourishment to body and spirit for both the client and the family, improving the quality of life for everybody and providing peace of mind. As a registered dietitian and the director of nutrition services at Food and Friends, serving seniors and their families in DC, I see every day the direct benefit that those seniors have in DC, and that the direct benefit they'll gain from this No Senior Hungry legislation. So on behalf of Food and Friends, we urge the council to pass this vital legislation, and thank you for having me today.
Thank you very much for your testimony. We'll now turn to Mr. Young. You're on.
Good morning, Chairperson Bonds, and thank you very much.
Good
On
morning.
behalf of the AARP DC State Office, my name is Virgil Young. I am a native Washingtonian and the Ward 4 AARP DC Volunteer Liaison. AARP appreciates the opportunity to provide written testimony on the proposed No Senior Hungry Omnibus Amendment Act of 2021. While AARP supports this legislation, we urge you to also include additional elements that would strengthen the bill and its impact on the food insecure Washingtonians. According to DC Greens, the district has the highest rate of food insecurity among seniors in the country, currently at 14.3%. This means more than 12,000 known district seniors lack consistent access to enough food. Additionally, seniors are known to have higher rates of food insecurity due to a variety of factors. These include fixed income, food deserts, accessibility to healthy food options, and social isolation. Senior food insecurity truly is a crisis in the District of Columbia, and it must be addressed. The pandemic provided an opportunity for the district, including its government agencies, to hone policies and procedures, as well as to improve service models for older adults. Food insecurity has been exacerbated by this public health crisis. While there are 14 nutrition programs operating in the district, the pandemic unfortunately proved there is little coordination between programs, not to mention little oversight to ensure the needs of older adults are being met. support for the No Senior Hungry Omnibus Act of 2021. In 2021, AARPDC was part of a 6-meeting work group, which resulted in the proposed No Senior Hungry Omnibus Amendment Act of 2021. Some of the positive elements of this act would include establishing an interagency senior food insecurity task force, requiring the Department on Aging and Community Living, DACL, to establish and implement a senior food insecurity plan, requiring DACL to develop a senior communications plan, implementing a complete overhaul of DACL's nutrition services, requiring the Department of Human Services, DHS, to increase the Supplemental Nutrition Assistant Program, also known as SNAP, participation, requiring the Office of the State Superintendent of Education, OSSE, to increase adult daycare participation in the Child and Adult Care Food Program, CACFP. And lastly, expanding the Elderly and Persons with Disabilities, EPD, waiver to include home delivered meals, nutrition supplements, and medical nutrition therapy, a suggestion AARPDC has been pushing for years. While AARPDC supports existing components of the proposed legislation, we urge the council to ensure accountability measures are put in place to support implementation of the bill. AARPDC urges the following changes to the legislation: requiring a new interagency senior food task force, and not simply just duplicative of current ineffective nutrition work groups within district agencies. This task force should include government agencies, community organizations with specific expertise in food hunger, as well as constituents that represent older adults, 50 plus. And I just want to point out, this is key, that we need to have representation of seniors. Who better else knows the predicament of seniors than seniors themselves? This is why it's so important to have constituencies representing older adults, because they are the ones that are being impacted. That is key. These representatives should be vetted through specific criteria. The task force recommendations should not only guide, but be the platform for performance for nutrition services. Setting a June 2022 deadline for DACL to deliver on a senior food insecurity plan with both quantitative and qualitative metrics, requiring quarterly reports from and oversight hearings for respective district agencies to review community outreach, meals provided, efforts to meet specialty diet needs, and spending towards the established plan. Auto-enrolling current and new Medicaid enrollees into SNAP, including the EPD waiver program. Furthermore, access and the need for nutrition services is a persistent problem. Most notably, this issue was highlighted by Director Laura Newland during DACL's most recent performance oversight hearing. DACL's performance oversight filing placed the current rate of senior hunger in the district at 13.5%. DACL also reported a 50% increase in home delivered meals within the first month of FY 2022, that being October 2021, and a substantial increase in congregate or community meals at various senior centers. This increase represents a growing need amongst these district seniors. The district needs a solid plan to fix food insecurity and to immediately establish maximum accountability measures to ensure government agencies address this dire issue. Recent disjointed changes like DACL's decision to bring nutrition services in-house with zero warning or community input can further strain access among district seniors. AARP demands immediate oversight, experts at the table, as well as a community participation to support the streamlined coordination of all senior nutrition programs. AARP appreciates the opportunity to submit testimony and offers both our assistance and expertise in moving this bill forward. We look forward to working with you and continuing to work alongside nutrition advocates to bring the district's 50+ population better and more valuable nutrition services. I am available to answer any questions at this time. Thank you.
Thank you very much, panelists, for your comments. I believe Councilmember Shea is still with us. Okay, Councilmember Shea, I'm going to give you an opportunity to begin the questioning, if that's okay with you.
That's perfectly fine. Thank you, Councilmember Bonds. I don't have any particular questions, but I do have a couple of comments. Number one, I want to take this opportunity yet again to thank any and all of the people who over months and months and months worked with the group that I formed to put in their ideas and to help us come up with this legislation. Second, I'm taken by the comments of many of the witnesses in terms of the interrelationship that food has with so many other areas, in particular, how nutrition and health and medicine are inextricably linked. And we have to have a sufficiently flexible set of programs where we can provide fresh, nutritious food to seniors and also to tailor it in certain circumstances to folks who have particular medical needs. And, that's vitally important. The idea that food is medicine, I think, has finally taken hold, and we understand that more than ever. So with those comments, I also want to say to everybody, thank you for your suggestions about how to improve this bill. And again, thank everybody who's been on this little journey for these many months. So thank you, Councilmember Bonds.
Thank you very much for your comments. I just have a few questions as you were providing testimony, panelists. I have some questions about some of the processes that you were suggesting. One, I guess to Mr. Young, you mentioned this. Do you have ideas, or your organization have ideas on how to roll out the enrollment, specifically the EPD waiver for qualified nutritional needs?
Thank you, Madam Chair. Absolutely. And I would, rather than getting into the weeds, I would certainly make our experts at AARP available to you to give you a very granular point of view. So suffice to say, yes, we do have the the abilities and the research analysts and the experts to provide you some more detail on that. Absolutely. Yes, ma'am.
I think that's a very important aspect of the expansion, and certainly making meals and food nutrition available to those with special needs. I wonder, Ms. Khan, if you have some thoughts on that as to how we might roll out this enrollment process so that it can be comprehensive and can get to the issue that is on hand.
Sure, thank you for asking. Something that I'm envisioning as a starting point in the conversation is using the task force as sort of a shared referral process. And that way folks will be able to see, kind of the intake, and okay, this person might be best suited by this organization because of geography, or this organization because of medical need, or this organization because of their transportation needs. So it's sort of like looking at things holistically across the city, having the different task force members look at things across the city so that nobody is getting served by too many organizations, but also nobody's really falling through the cracks there. So some kind of shared referral system.
Okay. All right, that's pretty interesting and pretty challenging, as you all have spoken to. Mr. Moore, you want to give us your feed on that?
Sure, and you really do have the right experts on this panel outside of me to talk about some of these more granular pieces, in particular around the EPD waiver. I'll just say that I think I would be far less concerned about us over-enrolling seniors in too many services than having them not access enough services. And I think there are so many access points right now in our community that are not being fully leveraged, whether those are federal resources, local dollars, or private sector nonprofit initiatives, that this coordination piece is going to be so important. And to the previous point around flexibility, some folks' experiences are daily needs. Some are more monthly, some are seasonal, some deal with when there's sort of a more acute health issue. And having that type of responsiveness in the framework is going to be really, really important to addressing the variety of needs that folks are going to be experiencing over the next several years.
All right, well, I appreciate that. And then I wanted to ask a little bit about, you also spoke about not just coordination, and you spoke mostly about communication. How do we inform and get more seniors the opportunity to have quality nutritional in their, I'll say within their prescription for better health? And I'm wondering, should we go beyond just what flyers and the usual systems that we like to use? I'm trying very hard not to say the internet, but certainly because so many of our seniors are not on the internet, and they're certainly not on it every day, every minute, like many of us are. And so are we thinking that maybe commercials on television shows and cable would somehow could get us a stronger enrollment in any of these programs? Have any of you used that medium and found it to be, extraordinarily beneficial of informing and bringing in new participants? Anyone?
Madam Chair,
Ms. Houston? Okay.
if I might, I think that I have not, DC Greens does not provide, those kinds of direct services, but I really think it's about talking to seniors themselves, talking to community leaders, talking to the faith community. I was talking to a pastor recently who said to me, even when someone doesn't tell me exactly what their issues are, I know, or I know someone in my another parishioner who knows. Talk to the faith community. Talk to those community organizations. they will tell you how best to communicate with people that they know. And I see that Ms. B is offering her expertise, and I would defer to her. Ms. B?
Yes, definitely. Ms.
Oh,
Evans.
thank you. We know how many senior buildings we have in Ward 7. We know how many senior buildings in Ward 8. Why can't somebody go to each one of those buildings, connect with the people who are organizing and leading, and we know what's going on in our business. I know who my neighbors are. I know what's going on, and they'll talk to me. So and we can have it at our tenant association meetings. You know, right now y'all have left us behind with this technology. I'm in my manager's office because I was stressing out of trying to get on this thing, and I'm still stressing out, but that's how I communicate with my folks, and I'm connected with other senior buildings in Ward 7. We're organizing. So we need y'all to, you know, I'm glad that you're hearing us about this problem, you know, but there are some good examples out there, but I want the quality. But like I said, one of my neighbors, Ms. Carmelita, is going to talk about the other part, y'all talking about the administrative part of how to get to us. Are y'all really concerned about us? We are active out here. We just don't know how to connect with this technology. But please come out and we can start from there.
Well, thank you very much. And just one last aspect, which is, you know, concerning to me, is whether or not we have the capacity from the organizations that prepare meals, such as Food and Friends and Central Kitchen, to actually deliver to, let's say, persons who are living in assisted living or in nursing homes. Do you want to share any thoughts on that? Mr. Moore, I see you nodding.
I saw Ms. Khan coming off mute, so I want to defer to her.
Sure. The short answer is we do have the ability to do that. And if those places are already providing food, though, then, you know, maybe our role is to provide some technical assistance or expertise, because to my knowledge, a lot of those places already have a kitchen and are serving their folks. But if there's a medical need that they can't quite meet, then we do step in. So if somebody, you know, is living in one of those facilities and on a very specific diet for dialysis care, or, you know, is having trouble swallowing and needs pureed food, we are happy to go and deliver there. And we work with the staff or the neighbors or the family members to make sure if that person's not home or available, we'll deliver it to somebody else and make sure that they get food that day.
Well, thank you.
And if I can, Councilmember Bond,
yes,
just to pick up that thread, we absolutely have capacity in this community to produce the meals that we need. When you think about between the nonprofits, the local businesses who want to be part of the solution, we can do it as a city. On the direct distribution, that last mile distribution front, there's absolutely some capacity. There is room for more. And I want to give a lot of credit to the DACL team. There are some new folks working on nutrition issues there who have been so open and responsive to working with us. And we're looking at a new last mile delivery pilot that we'll be looking at launching in the next just couple of weeks here to try to see if we can create some new innovative disruptions in that space. And they've been very responsive and open and helping us figure out how we can do that and learn together. But I think the last piece is building that trust. And Ms. Evans is such a wonderful example of that. When you have seniors who know their communities, are willing to advocate, we have to give them the resources to help connect seniors with here's what's in the community. Here's what we can do for you. And destigmatize, lower those barriers to ask for help, because people don't know what help to ask for or where to go for that next step. If we can really empower folks at every level of community with those networks and with that map of what you can do next, I'm confident those last mile questions can be solved. But it's about getting the data and that widespread knowledge and trust to take that step forward and ask for that help and get that request to the right person who can solve for it. And I think we're close as a community, and this bill can help us do that.
Madam Chair, as a follow-up, this is Virgil Young, AARP.
Yes.
I think when you look at the as everyone has stated, you have people in senior homes. I think that's the low hanging fruit. We can get them. And the way I'm really interested in for seniors who are living in homes who are not in community areas. Those are the people like who are eating Hostess Twinkies for, I mean, that's their lunch. That we cannot have that. We need to, as Ms. Evans says, we need to get the civic associations on one echelon. Then you have the ANCs, and then they report up to the council. We need to have a pipeline of information. So those civic associations, they can penetrate deep into areas where we can't. And so there has to be an information flow and a certain amount of rigor applied to these periodic meetings. Like in Ward 4, they have the ANCs get together and meet at the police station. We need to have rigorous oversight of the way the information goes up and down the chain of command again. And so, because that's who I'm worried about, the seniors that are living by themselves in apartments or homes that don't have the luxury of a assisted living. I mean, I think we can do a great job there, but we need to really we need to tackle this thing. And you know, we get memos, we get analysis. You got to get boots on the ground. I'm a military veteran. We got to get in here. And I think there's a great opportunity to do it. There's a need. I mean, it's ridiculous that you have people who can't take care of themselves, elderly people, and can't get any food. We're the ones with the power, the infrastructure. And so this is part of infrastructure. And I'm going to speak for myself. I'm not going to speak for AARP. When developers get deals and abatements and they can come in, there should be some rider attached to say, hey, you know, you're going to have some sort of community responsibility to take care of seniors, everything, food, everything. And, you know, hit these developers even before they come into the city. Okay, you want to do business in DC? This is one thing you're going to have to do. And that would alleviate a lot of this stuff. So, I mean, there are things that we can do.
Mr. Young, thank you very much for that comment, because my next question was to ask about how do we reach those persons we know are isolated. They don't have friend circles. They don't talk to many folk, keep to themselves. And I suspect that many also not only eat Twinkies, like you said, for lunch or even breakfast, they probably don't use the mediums for preparing food. And that's a big concern. So whatever is convenient. I have actually am aware of some seniors that will take a sandwich that has been delivered out of the refrigerator and sit it on the drain and wait 3 or 4 hours for it to get mildly warm enough to consume. Okay. Now, these are people who are intelligent. That isn't the issue, that they don't know how to look after themselves. They just don't know how to use the system, or they are not encouraged to really take care of themselves. So they're really kind of just existing. And that is a big concern of mine, and I'm sure of yours and our entire city. So I appreciate your comments, Mr. Young.
Yes, but I just want to add one last thing.
Mm-hmm.
If we look at all the people on this Zoom call right now, one day we're going to be at a point where we cannot take care of ourselves. Okay, the people we're talking about taking care of us, I mean, the people we're talking about trying to take care of, that's us. Literally, that's us. That's Mr. Moore. That's me. That's Miss Khan. That's us.
That's me.
And that's how we need to attack this problem is, what are we going to do when this happens to us? And trust me, if we think of it in that manner, because that's who it is. It's not some people other than us, it's us. We're all connected. If we try to tackle it like that, we can get some stuff done. Thank you.
Well, thank you. Thank you very much, panelists. You're extraordinary and have contributed much to our goal, how we're focused. So thank you. Ms. Evans, do you still have your hand up?
No.
Okay,
No.
all righty. Okay, thank you. And we'll now move to the next panel. Thank you all very much for your testimony today.
Council member?
Yes, Do we
just
have
have-
another group?
Yeah, let me just give me a second to move them in.
All righty.
Okay, you should have panel 2, George Kerr, founder and CEO from GIII Associates, Alexis Blackman, executive director of Casa Ruby, Marianne Peel, the senior director of commodity supplement from Capital Area Food Bank, Angie Henderson, public witness, and then Wanda Dudley, public witness.
All right. Mr. Kerr, we will start with you when you're ready. And welcome. Good morning. Good afternoon now, everyone.
Good morning, council member. I am George Kerr III, founder, CEO for G3 Associates and a U.S. Navy veteran. I also serve on the LGBTQ Budget Coalition. Thank you for allowing me to testify as an advocate for approximately 10.8% or more of the district residents that identify as LGBTQ. In a recent report by Emerson Hunger Fellow of the DC Office of Planning, opportunities to strengthen nutrition programs in DC to address senior food insecurity. The report found that discrimination, bullying, and inadequate culture competency can also make programs unwelcoming to some seniors, especially those in the LGBTQ community. Including seniors in the program, development can help identify and prevent accessibility issues. This legislation should add marketing and outreach to the LGBTQ seniors. I am also asking that the mayor's office on LGBTQ affairs be or their designee to be a part of the task force. As a gay man thriving with HIV for over 26 years, I have another concern with older people living with HIV. The community recognizes the passage of Bill 2337, Care for the LGBTQ Seniors and Seniors with HIV Care Act of 2019. Bill 24-0419 should work with this legislation. We look forward to working closely with the agency and the Director Newland in addressing these concerns. Thank you for your consideration. I am available for questions.
Thank you very much for your testimony, Mr. Kerr. Ms. Blackman?
She is not here apparently.
She's not here? All right. Ms. Peel? We'll get your testimony now.
Good morning.
Good morning.
Somebody up here. Good morning again, Chairwoman Bonds, committee members and colleagues. My name is Marion Peel, and I am the Senior Director of the Commodity Supplemental Food Program at the Capital Area Food Bank. The program is also known as CFSP. Thank you for the opportunity to testify in favor of the No Senior Hungry Omnibus Act and for your consideration of the bill. The Capital Area Food Bank is the sole Feeding America food bank serving DC and has been a leader in hunger relief for 42 years in our community. We serve the more than 81,000 DC residents facing food insecurity. As you well know, that includes 12,000 seniors who struggle to access their next meal. I have worked at the food bank for more than 31 years. And again, I oversee the CFSP program. This is a federal nutrition program which supplements the nutritional needs of low-income seniors. Last year, we served over 1 million meals to DC seniors through this program. In my role, I get to see the good, the bad, and the worst of senior hunger. The good is every single courageous client we serve. The compassion seniors express for our staff and for each other at distribution sites. The waves from windows to our delivery drivers, and the smiling faces despite hungry stomachs. We are privileged to serve such an outstanding senior community. But I also get to see the bad. The seniors who are homebound and simply can't access emergency food services. The increased chronic illnesses our seniors face because they lack nutritious meals, and the miles upon miles that our seniors have to travel just to buy affordable groceries. These are the terrible and detrimental impacts of senior hunger. And I get to see the worst of senior hunger. Unfortunately, every one of us here today gets to see the worst of that, because DC has the highest rate of senior food insecurity in the entire country. 14.3% of our seniors do not have access to nutritious food. That means 1 in every 7 seniors in our nation's capital is facing hunger. We know hunger takes a disproportionate toll for our communities of color and seniors residing in wards 7 and 8. Hunger is a result of years of injustice, racism, and neglect. And for our seniors, we must do better. The No Senior Hungry Omnibus Act is a step in the right direction. The legislation was crafted thoughtfully by many stakeholders in this community who have the deepest of roots. And the Capital Area Food Bank recommends you heed our advice for the sake of our seniors. First and foremost, the bill would increase our seniors' access to food and resources. It expands participation in SNAP, CACFP, home-delivered meals, and medical nutrition therapy. This bill will make it easier for seniors to understand what services are available to them by encouraging DC agencies to communicate the programs and the benefits at their disposal. And importantly, this bill will ensure that addressing senior hunger is a coordinated, centralized, and thoughtful effort in the district. The creation of an interagency task force will provide a level of community input and accountability that is much needed and long overdue. One thing is certain: the nation's capital should not have the worst levels of senior food insecurity in the nation. Together, we have the opportunity to change that, and I urge you to pass the No Senior Hungry Omnibus bill so all of our seniors can access the foods they need today for brighter futures tomorrow. Thank you, and I am available for questions.
Thank you very much for your testimony. Ms. Angie Henderson, we'll take your testimony now.
Great morning, all.
Good morning.
I am Andra Powell Henderson, a 75-year-old native Washingtonian residing in Ward 8. I am also a proud member of the Client Leadership Council of the Capital Area Food Bank. I moved into my current home 39 years ago in October 1982. I managed to care for myself and 3 daughters after a divorce while falling into the working poor category, even with child support and having 3 degrees. Though I had a long and interesting career spanning nearly 50 years, I failed to properly plan for retirement. I worked for the federal government, private industry, and 4 agencies of DC government. With all that I gave as a DC government employee and being a DC taxpayer, I've often wondered why DC isn't working for me since I am (2011). Since then, my payments have increased only $277 per month, including the recent 5.9% cost of living adjustment. There is little money to buy healthy groceries. My food budget is supplemented by capital area food bank boxes delivered by a friend. They are appreciated. It is reported that 25% of seniors 65 and older residing in Ward 8 live in poverty. I escaped the poverty level by less than $183 per month. I last applied for food stamps years ago when I was offered $11 a month. I did not accept them. It wasn't worth the bother and horror of the application process. Many seniors in Ward 8 experience myriad medical issues such as I, and many of us lack private transportation. We should not have to stand in lines waiting for social services offices to open or at churches or other facilities to obtain needed food. Why should we? There is no dignity there. If we manage to get to the grocery store, many of us use the services of the folks hanging around the store and pay them to return home. It's not the most ideal nor safest, but more affordable than a cab or shared rides such as Uber. If we can drive to the store, we usually drive to Maryland or Virginia, taking tax dollars with us. Since 1982, when I moved into my house 39 years ago, there have been 6 mayors, 8 city council chairs, 21 city council members at large, and 7 Ward 8 representatives to the city council. Yet I have seen very few changes for the better for Ward 8 residents. Today, in 2022, there is much to do, starting with assuring that seniors in Ward 8 have access to healthy and affordable food choices on a regular basis. Therefore, I strongly support the proposed legislation of the No Senior Hungry Omnibus. Thank you very much for having let me speak.
Thank you very much for your testimony. Thank you. Now we will hear from Ms. Dudley. All right.
Good morning.
Good morning.
Chairman Bonds. My name is Wanda Dudley. I live in the heart of Southeast Ward 8. I'm here today to thank you for your support of this legislation, and I would like to see that strong support remain. As a volunteer lead coordinator for the UPO, United Planning Organization, and also a Client Leadership Council advocate member, the CLC, for seniors and Grocery Plus, I am indeed aware and knowledgeable of knowing the importance of senior hunger and insecurities and availabilities of food. Through conversation with my kings and queens, some don't receive food stamps, and the ones that do only receive a few dollars, and only a few dollars separate them from receiving the money. They average about $25 to $95 per month, which put them in a dilemma of either buying the chicken or the eggs, or the eggs or the chicken. I myself fell victim to the insecurities of not having food. I ate beans for about 6 months because I didn't know where to turn, or waiting for the paperwork to be processed. And now we have the unreachables, the ones we don't see or hear until they pass away from hunger. If I ask for food right now, I'm hungry now, not waiting 3 or 4 days for paperwork to be processed. It should be more easier, it should be convenient, and it should not be embarrassing. It should be just, and it should be fair. Our community has been plagued with high blood pressure, diabetes, and heart disease because of our food choices and food availability. Most of our seniors eat to survive and not to be healthy, because health is not affordable or it does not fit into their budget. One of the biggest obstacles is to navigate through hunger. How do we feed ourselves? I've learned from experience, from the lowest of lows is where you learn the most. Being without teaches us resilience, and we eat what's available to us. It makes us in a mode of eating to survive. Should this legislation continue? Yes. Is it beneficial? Yes. Should it be funded? Yes. My voice cries out to you to please help us to live a healthier life. My kings and queens of Washington, D.C., the heart of our country deserve access to healthy and affordable food. I thank you for your time.
Thank you. Thank you very much for your testimony. In fact, thanks to the entire panel. I just wanted to make sure that I speak to Mr. Kerr in particular, because you brought up a point that I think we had not included in the plan, and that is to make sure that we have the LGBTQ community represented on the task force. And so I made a note of that for sure. So thank you for reminding us. It's so easy to forget. When you think of seniors, you just see seniors. You see elderly, you see aging people, and you never think about the particular lifestyle that people may be and the needs of those lifestyles. And they do differ from time to time. So just want to make sure that everyone is included. And so thank you for reminding of how important it is to not discriminate against any group within our community, that we all have great value and we all contribute to what makes our city wonderful and getting better for those who are without the food. And that's to Ms. Dudley's point and to Ms. Henderson's point. So thank you, and thanks to the food bank for all that you do. Now I see Councilmember Shay is back with us. Councilwoman, you have some questions of this group?
Well, I haven't left you. I just put
okay.
In any event, because I wanted to hear the testimony. No, I don't have any questions for this group, but again, thanks to all of those who testified. Particularly thank you for your suggestions for improvement, and thanks those of you who participated in all the work that led up to this. Thanks, Councilmember Bonds.
Thank you. Thank you very much. I do have a question for Ms. Henderson and Ms. Dudley. Just want to try and understand a little bit about this resource that you mentioned, the financial resource that you currently have that sounds very small and in what it can provide for you. I think, Ms. Henderson, you mentioned $11 a month. Is that food stamps or?
That was
SNAP.
That's SNAP?
Yes, that was
Okay.
food stamps, and that was years ago. Not now, yes, but not now. I haven't been back since then.
Okay, all right. But you also mentioned how it was a deterrent from even, because there was so much paperwork in order to walk away with a minuscule amount of resources that you were discouraged from even participating. So we'll check on that and see if that's still the case.
I have
going to human services. Okay.
Okay, I deal with a lot of seniors for the first couple of weeks of every month because I do issue food boxes from Capital Area Food Bank. And I do interact with a lot of seniors, and they say that they give up because it's too intimidating, mostly to fill out those papers, you know, and it's too time consuming. We as seniors, we like it like fast, you know, like yesterday and stuff. And a lot of them is confused. And then when they get it, it's like maybe $25. And even though Miss Henderson had hers $11 a few years ago, we are talking only maybe 3 years ago, someone was telling me that they signed up for SNAP and they offered them $25. $25. And what was she supposed to do with $25?
Mm-hmm.
You know,
That's
it's not a month's supply of food that you can get for $25.
Yes, no. Believe me, I think everyone knows that, especially in today's economy, coming out of the pandemic. It's very, very difficult. Inflation is very high. Yes, I hear you. So I'm sure those that are the recipients are finding it even more challenging today. So I just want to make sure we put that on the record. And it's an aspect of this piece of legislation that we want to look at as well. So thank you very much for that. Thank you to this panel. And we'll move now to our next panel.
Yeah, so we have panel 3, Karen Zuckerstein, who's the first vice chair for Ward 3 Democrats. Dorothy Douglas, commissioner, ANC commissioner for single member district 1703. Michelle Tingling Clemens, who's the president of Central Northeast Civic Association. Raymond Tolson, public witness, and Melissa Jensen, anti-hunger policy analyst at DC Hunger Solutions.
All right. Do you have everyone in the room?
Yes, they're ready for you.
All right. We'll start with Ms. Zuckerstein. Welcome. Good morning.
Good morning. My name is Karen Zuckerstein, and I am Vice Chair of the Ward 3 Democratic Committee. I wish to thank Chairperson Bonds, Councilmember Che, and members of this committee for the opportunity to provide testimony on the No Senior Hungry Act. By way of background, the Ward 3 Democratic Committee is composed of about 90 Ward 3 Democratic Party activists. Our membership conducts research and formulates positions and recommendations on issues of significance in DC. Seniors in the district struggle to obtain enough food to live a healthy lifestyle. The depth of this problem is such that DC ranks at the top of the Food Insecurity Index put together by Feeding America. This is deeply disturbing, especially given the relative wealth of our community. We cannot ignore this problem. There are about 14 nutrition-focused programs available to DC's older adults. These include programs targeting seniors, such as congregate meals and seniors farmers markets, as well as programs that include seniors as part of a broader population, such as SNAP. Some programs specifically focus on providing seniors with healthy, nutritious foods. The No Senior Hungry Act focuses on better defining who are the food insecure and identifying root causes. It seeks to answer the question of why existing programs are not reaching food insecure seniors. It calls for examining how district agencies communicate with seniors and addressing how transportation and other challenges affect the ability to access food. In November, the Ward 3 Democrats sent a resolution to every council member urging adoption of this legislation. It provides a process for better understanding the problems so that existing programs and new initiatives can eliminate food insecurity in the district. There is no reason for any senior to lack access to the food needed to support a healthy lifestyle. Thank you for the opportunity to testify. I am happy to answer any questions.
Thank you very much for your testimony. Commissioner Douglas, we'll get your testimony now. Good morning.
Good morning, everybody, and happy Valentine. My name is Commissioner Douglas, Dr. Douglas, ANC 703. I'm also a Ward 7 resident in the neighborhood Washingtonian. Good morning, Councilman Anita Bonds, as well as Mrs. Councilman Che. It's a pleasure. I appreciate you holding this hearing for us to hear about the No Senior Hungry Act of 2021. I am passionate about the commitment to provide the voice for our seniors that I'm testifying for today, and also supporting the senior citizens during this hunger academic pandemic, COVID-19, that is so well needed, and due to this increase of those circumstances. I would like to say senior citizens are being challenged on that challenge experience. The challenge experience that they had before us is a one-time life. Often there are obstacles in their way that cause them not to achieve proper food. Those are facts. They're facing challenges uh, in their golden years and denied these benefits. Nearly 5.5 million Americans, seniors from 60 over, faces hunger, and many of our senior citizens are forced to choose buying groceries or medication. Also, I wanted to share with you as well that 70 and 40 senior citizens of age most likely to face food insecurity. That's over 5 million low-income residents. And we're talking about not only the district, but around our city, around the world. And ours are included in that. And the other concern that concerns me is that the payment is my colleagues and those on the phone has already spoke about is the money they receive. Some receive $120 a month. Now I'm blessed to say that with a little bit, but not much. I notice when I go to the store, food costs me about $300 just to feed me. Because remember, we just not eating one meal a day. We got breakfast, lunch, and dinner, and snacks. So when I go to the grocery store with the increase of cost of living, I'm spending at least $300 a month for food, for healthy food, that is. Several factors contribute to the low participation of many seniors is facing barriers related to mobile. They need communications, and I think some of the residents, the panelists that already spoke on that. Internet is an important factor because that's the way life is now. That's the norm. So I think we need training and skills for those technologies and those that don't have computers. So this is widely spread is needed in communication. Some residents can't even read or write. Example, my residents in Kenilworth and even the ones that I communicate with as ANC commissioner, and even myself, there's no communication. And as someone has said earlier, you need a pipeline. I think that was Mr. Young. You need we're all in here together to do this, but the services are just lacking. When you call, I have called several times during the COVID-19 pandemic. When you call Department of Aging, no one answers the phone. You call Department of Housing, where you have different grants and funds that help seniors to prepare the houses and other things, you don't get a return call. Those are the things. So we need that in place. And also the nutrition, as they spoke, the health-wise. You got diabetes, pressure, high blood pressure, and heart failure. All these things when they don't lack. And this is what the young lady has said earlier. And I learned through some research that I wasn't even aware that Walmarts have a foundation that teaches our seniors and how to prepare them to get food stamp or snaps to help them to guide to get these this food and the services. And one time we had Georgetown University that would help seniors to walk them through. That program has cut out. I'm not going. I just want to say, and also, where's the accountability for access for those that don't have uh, that needs access to get in as seniors that have disabilities accommodation. That is another issue too. That even with the proper motor vehicle, I had to stand in line just to renew my license, and also I've seen people in the wheelchairs. Those things are really important. So I just want to say I appreciate you all listening, and I'm thanking you all for having this opportunity. But there's so many others, and I'm going to send my written testimony in on this part. But I want to thank you, Ms. Councilman Nita Barnes. And I just want to say, a lot of times, just because a person smiles, that don't mean that they're hungry. Because I'm a person that smile a lot, but you never saying you never know that I'm hungry. So you have a lot of folks that are smiling and keep from crying because they're hungry. So I'm in support of this bill. And I hope that you will put people in place that work with those folks that need it. The veterans, the GBLT community. They are important just as anyone else that need to be a part of that task force. And I would like to be a part of that as well, because we have so many people. I want to mention one more thing. Miss Barbara McCoy used to take me around with her to different churches to feed her, to put food on her table. We need to get the churches back involved. The churches, you have everything right here. We kind of like revolving the wheel all over again. This here, all we need to do is connect and make sure we still have people in person to answer the phone call when the seniors are in need. So everybody has already said a lot. I know, and I don't want to take up too much time, but thank you so much for this bill. And I'd like to see everybody be receiving food and not to walk. Kenilworth residents can't get to the schools because of transportation, as someone has already mentioned. So those things need to be in place. And Metro don't run no more. So yeah, they're cutting back. So we need to prepare all the stuff for our folks to be a part of getting these services. And I would suggest if you get the schools to be involved and teach them how to help the seniors with this a program that's set to help them to work together to help our seniors that can't read and write, and people with different language, the blind, and also the persons that can't hear. So those programs and handbooks need to be also be in place as well for our seniors. And thank you so much for giving me this opportunity to speak. But I could go more and more, but everyone has really covered all that. But thank you, Councilman Nita Barnes, once again, and happy Valentine's to you and Ms. Che. So this is really kind of touching to me. So I just wanted to share that with you, because hunger is really something. Thank you.
Thank you very much for your testimony, Commissioner. It's always good to hear from you, and I know you reach out and talk to a lot of seniors on the ground. So thank you very much for that testimony. Next, we have Ms. Tingling Clemens, President of the Central Northeast Civic Association. Ms. Tingling? We'll take your testimony now.
Need to be unmuted.
All right, now we can hear you.
I know I couldn't quite get to the unmute. Good afternoon, Council Member Bonds, Council Member Che, fellow residents and hunger warriors. I come here to praise this effort, the No Senior Hungry Omnibus amendment legislation, and to talk about the holes and the gaps that we know are there that really need to be there to help strengthen this legislation and our efforts to address senior hunger in the district. I'm the president, as was said earlier, of Central Northeast Civic Association out here in Ward 7. I'm also the co-convener of Gray Panthers of Metropolitan Washington. And I want to say that as a senior, that many of us have become seniors not noticing the transition because we were still doing the same work. We were still agitating the same. I seen a number of faces and names on this list of people who have aged, who have become seniors along with me. So I say to all of you first that if you're lucky, you get to be where we are now. So we get another chance to agitate, even as our hair is turned gray and silver or not. But our attitudes have come along with us. I want to associate myself with many of the statements that were made earlier, especially by all of the community operations. And a lot of people, I've had the opportunity to learn more about a lot of these organizations as I've been there as they started, as I used to be in positions in the district government where I had to monitor their funding and help them identify how they were going to use it to help alleviate hunger in the district. And over 20 years ago, my husband and I convened a conference called In the Winter of Our Lives over at Howard University, where we were then looking at the fact that seniors were being eased out of support for healthcare. And as somebody said earlier in this hearing, our food is our healthcare. You know, if we know how to eat well, if we learn those skills early, then it helps to alleviate many of the ailments that many of us are finding ourselves suffering from, like those that have been mentioned, like diabetes, their heart issues, and many of these can be addressed with diet, but they're not being, you have to have access to those foods in order to make sure that that's happening. And I have a number of, people have talked a lot about the extent and details on the problem. I don't know how many people are aware that the district not only has the highest level of senior hunger in the country, but we also have the highest number of people of color that are hearing impaired in the country. And a lot of that has to do with the existence of Gallaudet and the fact that it was not a discriminatory institution and welcomed people of all races. So, I mean, these are things that have come up over the years as we have been assessing the level of hunger. And I think that this commission, when you hear about a task force and you've been doing this work as long as I have, you know, your first thought is like, another task force that's so time consuming, but that doesn't mean that it's not timely. Our efforts to really get a good handle on where the problem is, how we can address it, and what are the resources to deal with it have to be looked at on a systematic basis and not necessarily only by the people who are operating those programs. I want to say, as having operated those programs before, oftentimes there were things that we believed needed to happen, but that we couldn't move forward on because somebody over us would not approve it to move on it. So the district government, as much as it's been an asset, is also sometimes a hindrance. I think that we need to take advantage of the many senior advocates and agitators who are already doing some of that work for the district, and they need to be engaged in a more systematic fashion. We have seniors who are doing this work who could stand to be paid for some of their services, because we're also being eased out of our domiciles in the district. And we know that Ward 7 is the latest district target for gentrification. And I'm in Ward 7, so we need other folks who are in the leadership to recognize that and to help support us. We must hire more seniors. We could use more personal contact, printed material, and fonts that we can read. We've all got experience now with the teeny tiny print because they don't want us to know what all of the things are that we're not going to be getting. So to get materials like that look just like the ones from the folks who are cutting us out of things is not a sign of support. I also think that things like phone blasts and doing them not just in English, but in other languages, and not just for political purposes to make sure you get votes, but to make sure that people are engaged. And truthfully, as seniors, I always commend district workers who are working from home when I call them over the pandemic, because they are there and they're still helpful and they're very pleasant, you know, and I encourage them. But we need more personal contact. The internet is not a substitute for that, and it often makes us prey to the folks who are trying to get into our pockets. Other thing is, I don't know if you're aware, but the Interfaith Religious Council for years published, and still do, they publish a booklet on food resources all over the district. The district used to have those resources, but they no longer have agencies that are dedicated to those opportunities to make sure that you can communicate directly with residents. So I think that being able to, and I think that you need to have dedicated resources for that, but you also need to have dedicated staff for that. You know, one of the things, Ms. B, when I saw that name on the testimony list, I was like, okay, Ms. B is still out here. So I know that we're doing well and she's still alive, but we don't always know that. And the personal contact, there were some recommendations about sending things to the buildings where seniors are and get a lot of the information from there. They often can tell us what will bring people down to a meeting and what doesn't, but the ways in which they engage their seniors and reach out to. We have people who are expert in this because they're doing it. They're doing it because they recognize that it needs to be done, and that's how citizen activists have always been born. And they're doing it because it's where they are. And it's something, and it gives you some work that makes you feel good. And you know that you're doing a service to your colleagues in the district. But I mean, there's a lot more that can be said, but I know that many of us are aware of it. And I think Mr. Young said it earlier. If we look at the people on this call, it's not just that we will need these services, but many of us do need these services and are using them. I mean, people, you know, there was legislation that was passed some 30 years ago to put access to these programs through the Social Services Administration. but I wasn't paying attention, and I don't believe that they had anything in there to train social service agents to be able to help seniors who wanted to apply for food stamps through Social Service Administration. Because the idea is that if they were going there anyway, why should they have to go someplace else and wait in another line and wait for another reason to feel disrespected and tired? So I think these are some of the critical areas, and I think we've done some really good recommendations from residents here, and I hope that we take advantage of them and use us. We're here because we know that this is a vital program, vital programs. We're here because we know that this is an important need, and we're here because we're committed to making sure that it's taken care of. So thank you so much, Councilmember Bonds, Councilmember Che. I mean, it's good to know that there's still council members who are advocates for the people up there, because I know how easy it is to get distracted by all of the paperwork that we are inundated with. And we're fortunate that we even get that. But the reality is we need it in forms so we can make use of it, and we need the people out there helping to sell it. So thank you so much.
Thank you very much for your testimony. We'll now turn to Mr. Tolson. Mr. Tolson, you're on. Thank you.
Good morning.
Good morning.
Councilwoman Bonds and Councilwoman Shay. Let me just first of all, I echo a lot of what Miss Angie Henderson, I believe her name is, said, and also everything that Miss Michelle said. It's echoed, but let me just say that my name, first of all, is Raymond Tolson. I have been a resident of Ward 7 for about 75 years. I first want to thank you for allotting me the time to speak. As I read over the proposed legislation for no senior hunger omnibus, I would just like to express my sincere, genuine appreciation for your hard work and dedication to make it possible for senior citizens in this community to get the essential requirements that we need to avoid living a life of poverty. Also, I pledge my full support for this initiative. I always made time to assist senior citizens in my neighborhood who can't move around so well. On April the 5th of 2016, I was awarded the Mayor's Community Service Award for assisting fellow seniors and disabled residents to recover from the January 2016 2-foot snow blizzard that we had. I'm sure you all remember that one. I also deliver papers, deliver the East of the River magazine to seniors in my neighborhood who can't get out as much as a lot of us can. Also, my home was purchased by my grandfather back in the early 50s. The house was used by soldiers in World War II, I was told. During my grandfather's lifetime, he managed to pay for the house in full. He left the house to his two children, my father and my uncle. All three of them are now deceased. So I am basically living in this house that needs major repairs. Even though I qualify for government assistance based on my income, these repairs that are desperately needed right now, the government will not approve any assistance because my grandfather and his two children are still listed as the actual owners. all of whom are deceased. There came a time when my water was disconnected, and I was told by DC Water that the only person that could get the water cut back on was an owner. So I reached out to Vincent Gray, who was then the mayor of DC. And after explaining my situation to him, he helped me get the water turned back on. I would also like to inquire as to whether you have given any thought to a senior citizen real estate tax exempt program. Once again, thank you for your time, and I look forward to a favorable vote on this bill.
Thank you very much, Mr. Tolson, for your testimony. Thank you. And thank you for your service and for caring about the property and keeping it up.
And I'm also open for any questions or, whatever.
All right. Thank you. We'll now turn to Ms. Jensen for your testimony.
Hey, good afternoon now.
Good afternoon to you.
Thank you, Chairperson Bonds and the committee for convening this hearing and the opportunity to testify on the No Senior Hungry Omnibus Amendment Act. My name is Melissa Jensen. I'm an anti-hunger program and policy analyst at DC Hunger Solutions, and my work focused specifically on SNAP, the Supplemental Nutrition Assistance Program, and older adult hunger in DC. I'm going to skip a lot of the data I have in my testimony, but that will be submitted in the written testimony. But I do want to say that the Food Research and Action Center estimates that DC's food insecurity for older adults is actually 15%, much more than Feeding America estimated in their report. So DC Hunger Solutions supports this legislation for multiple reasons. I will focus on 3 of them. First, the Act gives DACL the authority it needs to aggressively pursue ending senior hunger. Right now, there's no government leader in the district to lead the campaign against senior hunger, although ending it is a priority of DACL and the Food Policy Council. While DACL may seem like the natural leader in these efforts, the Act officially empowers them to take this role. The Act will give them the authority to lead, as well as pave the way for additionally needed resources. Secondly, the Act mandates expanding SNAP access in a meaningful way. SNAP is a lifeline for many low-income DC residents, and studies show that older adults that use SNAP experience improved food insecurity, improved health, better nutrition, and better medication adherence. Despite these major benefits, only 46% of eligible adults over the age of 60 currently participate in SNAP in DC. One of the main reasons is that even though they are eligible, the application process is long and complicated. Another witness already spoke about this today. The application itself takes at least an hour to complete, and especially with the recent changes made by the Department of Healthcare Finance, and requires internet access and advanced computer literacy to do online. While there is a paper option, it's over 60 pages long and can be difficult to obtain and submit due to COVID-19. The application also requires numerous verification documents, some of which people do not have anymore, to verify information that DHS often already has access to, such as Social Security income, disability income, and citizenship status. When older adults do manage to clear these administrative hurdles, they often receive the minimum benefit amount, which is $30 a month. One way to increase this benefit amount is to submit medical costs, but this process is also timely and confusing for many. To increase SNAP participation among older adults, the Act would require DHS to adopt the Elderly Simplified Application Project, known as ESAP, a USDA project that seeks to increase participation among elderly low-income populations by streamlining the SNAP application and recertification process, by waiving recertification interview requirements, using data matches to reduce the amount of client-provided verifications, and extending the certification period to 36 months. Under ESAP, the application is generally about 2 to 3 pages long, and it makes the whole process much simpler for older adults. It would also require DHS to create a standard medical deduction to simplify the collection of medical expense information for senior clients. So instead of them having to find all their medical receipts, they would just automatically get this deduction. It will help increase their benefit amount. Other strategies to make SNAP enrollment easier for seniors, including streamlining submission process for rent, utilities, and other costs, and implement senior targeted outreach for SNAP are also included in the Act. Finally, the Act was created with community input and supported by DC older adults. The working groups included older adults affected by food insecurity, as well as organizations who serve them. Older adults know this is a monumental issue in DC and are looking for solutions that work rather than a confusing web of services to navigate. And I think the testimonies already given have well established that fact. While we heard feedback about possible improvement to the legislations, many which have been echoed today, every older adult we have spoken to is relieved that the district is finally acting on this issue. DC Hunger Solutions believes that this legislation is a great start to ensuring that older adults in the District of Columbia receive the nutrition services they deserve. We ask the committee to work to move this legislation along for passage, funding, and implementation. Thank you for your time, and I'm open to any questions as well.
Thank you very much for your testimony. And special thanks for putting on and in the record the cumbersomeness of the application process. It makes it very clear as to why we probably have so many seniors that may need the resources but are not taking advantage of it. And so we've got to find a way to change this 46% participation and move closer to 60, 70%. But thank you very much for that testimony. Thank you to all of the panelists. I, as you can see, have a list of things that you have shared with us that we want to make sure that we pay attention to. So thank you very much. I'll turn now to Councilmember Shea. She may have a few questions for you.
Again, thank you, Councilmember Bonds. I don't have questions. I simply want to thank the witnesses for taking the time and sharing their views with us. Thank you.
Thank you. Thank you all. And we will now turn to panel 4.
Okay.
Amelia.
Yep, panel 4, we have Linda Popejoy, Managing Attorney for Legal Counsel for the Elderly. Florian Filkins, who's a fellow at Congressional Hunger Center. Shane Johnson, Program Manager at Care Network DC, but Shane is not here. ANC Commissioner Adolfo Salim, he's not here either. We have Dr. Beverly Wheeler, Director of DC Hunger Solutions. So I'll move into panel 5, Martha Asefa, Outreach Associate of DC Hunger Solutions.
All right, we'll begin with Attorney Popejoy. We're ready.
Thank you so much, Chairperson Bonds and Councilmember Che and members and staff of the committee. My name is Linda Popejoy, and I'm the Managing Attorney of the Pro Bono Access to Justice practice at Legal Counsel for the Elderly. I'm also a proud DC resident of 20 years. I reside in Ward 3. LCE provides free and comprehensive legal and social work services to DC residents, and especially lower income DC residents. I and several of my staff, not my staff, of my colleagues participated last year in the No Senior Hungry Working Group that was organized by Councilmember Che. And I'm grateful for this opportunity to share information with the committee on this important issue and to voice LCE's support for this bill. LCE's low-income clients regularly face food insecurity, and we're frequently called on for assistance, particularly with regard to their SNAP benefits. So that's going to be the bulk of what I talk about. Often these seniors have trouble applying for or renewing their SNAP benefits due to the onerous application and recertification processes that Ms. Jensen just talked about. And some of our clients conclude it's not even worth it to apply for SNAP benefits. And indeed, many of them receive as little as $30 a month due to having some limited income, such as SSI. But of course, that does not mean that they can afford healthy food on a regular basis. And it's also important to remember, we've talked about how people with medical conditions may need special diets. Those special diets are often more expensive than what food would be required for someone who didn't have that medical condition. So our seniors' needs can be even greater. A common issue for our clients is that they miss the deadline for their SNAP recertification and have their benefits cut off as a result. Many clients report not receiving the notification at all, and others may misunderstand it because the language can be difficult to comprehend. As another witness testified, it can be hard just to read it if it's in small print, or they may not have great reading skills. Other clients simply forget that they need to recertify. We often hear from our clients who are on the verge of getting evicted or whose homes may be up for tax sale or who are facing some other crisis, and the last thing they can deal with is reapplying for their SNAP benefits, especially when it's so difficult. And although the amount of benefits was increased during the pandemic, we understand those benefits have already started being reduced, in some cases to amounts lower than what they had prior to the pandemic. This is very distressing for our clients who truly struggle to put food on the table every day. Our clients also face issues with getting to grocery stores due to mobility issues, lack of transportation, or living in food deserts. Clients have also reported a lack of response when contacting the Department of Human Services, and then they must turn to other nonprofit or social service agencies like LCE just to apply for benefits or to find out the status of their application, which can take months to resolve in some cases. At the DHS centers, information is not available in languages other than English, and non-native English speakers are sometimes treated disrespectfully. While LCE absolutely supports the passage of the No Senior Hungry Omnibus Amendment Act, we believe the bill could do even more to address the crisis at hand. So I'm going to discuss two recommendations that will strengthen the bill and consequently advance food security for seniors in the district. First, we believe the bill's deadline for the preparation of the food security plan and the related communications plan of July 1st, 2023 is just too far in the future. And the AARP volunteer referenced that as well. We recommend a shorter turnaround time for the initial plans to be developed, particularly considering that our working group has already compiled a lot of the information necessary for the preparation of these plans. We further recommend an earlier date for the first progress report to the mayor and council, as the current bill doesn't require any progress report until 2025, and that's simply too far in the future. Second, the district should adopt, or we recommend they adopt, a system already utilized by 17 other states, including Maryland and Virginia, in which individuals are deemed automatically eligible for SNAP based on their enrollment in SSI, a program that automatically enrolls SSI recipients who live alone into SNAP. This program requires no separate applications or verifications, no interviews for elderly SSI recipients to get SNAP benefits. Once they become an SSI recipient, they are automatically enrolled in SNAP and their EBT cards are mailed to them. This program in the first year in New York generated 90,000 new seniors getting SNAP benefits, and even more in the years after that. This program also had cost savings associated with it, even though more people were getting benefits, because the SNAP office did not have to spend as much time processing applications, interviewing clients, or closing cases for failure to recertify. The district should implement a similarly simplified and streamlined process for its seniors. So in conclusion, LCE enthusiastically supports the passage of the No Senior Hungry Act, but believes these suggestions presented today will strengthen the bill so that it can more effectively fight food insecurity for our oldest residents. Thank you so much.
Thank you very much for your testimony. Wow. Okay. We'll now hear from Mr. Filkin.
Good afternoon, Chairperson Bonds.
Good afternoon.
Thank you for convening this hearing and considering this bill. My name is Florian Filkins. I'm a Bill Emerson National Hunger Fellow who was placed with the DC Office of Planning Food Policy Division in the fall of 2021 to conduct research on senior food insecurity and nutrition program access in DC. This research supported the DC Food Policy Council's 2021 priority of addressing DC's high senior food insecurity rate. Specifically, the goal of my research was to identify barriers to nutrition program access for seniors in DC, such as limited digital literacy, language barriers, limited access to transportation, and many others. To do this, I started with a literature review to identify common barriers to access for US seniors. I then conducted interviews with 22 nutrition program staff and 14 food insecure seniors. I completed a report that summarizes the themes from this research and proposes recommendations to better leverage government-funded nutrition programs to address senior food insecurity in the district. My report identified opportunities for improvements in 3 categories: communication, enrollment, and the user experience. Regarding communication, I found that nutrition programs often lack adequate funding to devote to communication, resulting in outreach that misses some populations. Regarding enrollment, I found that some seniors face language, transportation, and technology barriers that make it difficult to enroll in nutrition programs. Regarding user experiences, seniors reported issues with food quality, inadequate benefits, the physical and social accessibility of spaces, and delivery eligibility criteria. Across all 3 categories, a lack of coordination between nutrition programs limits accessibility and efficiency. The No Senior Hungry Omnibus Amendment Act of 2021 would help address some of these issues and connect more seniors to nutrition services by centralizing communication through DACL and requiring that DACL refer clients to other nutrition programs. Coordinating data collection through DACL will help the district government understand who is using services, allowing the implementation of data-driven changes. The creation of a senior food insecurity task force is especially valuable. However, the proposed composure of the task force could be more inclusive. The number of members from organizations serving seniors and the number of senior clients should be increased to include representation from more communities. Language could be included to require representation from organizations and seniors in each ward and from populations with high rates of food insecurity. This bill also mentions that there will be opportunities for public comment on the Senior Nutrition Services Communications Plan and the Senior Food Security Plan. Measures should be taken to ensure that seniors can provide input on proposed plans, regardless of digital literacy, disability, or other potential barriers. Resulting changes and the logic behind them should be publicized, including changes based on feedback from seniors. The components of the bill that amend the Food Stamp Expansion Act of 2009, the Healthy Tots Act of 2014, and the Department of Healthcare Finance Establishment Act of 2007 would be especially impactful, helping to reduce local senior food insecurity using federal funding. One additional opportunity would be to require the Department of Healthcare Finance to include food insecurity screening and referrals in contracts with Medicaid managed care organizations. This could help ensure that Medicaid clients, who are often low income, are connected to nutrition services. I look forward to sharing with the committee my full report, which provides more detailed analysis and recommendations for addressing senior food insecurity in the district. I'm happy to answer any questions you may have.
And thank you very much for your testimony. And I would love to have a chance to look at this report that you have prepared. Thank you so much. Next, we'll turn to Dr. Wheeler.
Good afternoon, Chairperson Bonds, Council Member Che, committee members who might be listening, and staff. My name is Beverly Wheeler. I'm the director of DC Hunger Solutions. We work to create a hunger-free community and improve the health, nutrition, well-being, and economic security of low-income residents in the District of Columbia. It is my pleasure to come before you today to testify on Bill 24-0419, also known as the No Senior Hungry Omnibus Amendment Act of 2021. I believe that this is the most consequential piece of legislation addressing the needs of seniors in the District of Columbia that we have seen in quite some time. The District of Columbia, the capital of the United States of America, currently ranks as #1 in food insecurity in the nation. We all agree that that is unacceptable. 17% of our seniors live in poverty. Over 12,000 of our seniors face some form of hunger. And people have mentioned it before. Sometimes this may look like food insecurity, skipped meals, difficulty paying bills, and or cutting back on medication. The number of seniors impacted by food insecurity it has been noted, is expected to increase by 20,000 by 2030. I want to commend Councilmember Che and her staff for convening 6 working groups comprised of government staff, community-based organizations, community leaders, and older adults over a 6-month period in 2021 to develop the legislation before us today. This legislation, if passed, would do a number of things. It would create an interagency senior food insecurity task force, create a senior food security plan, report on the current state of senior hunger in the district, identify all nutrition services, and make recommendations on improving existing nutrition programs for seniors. It's important to note that this legislation outlines specific tasks for agencies throughout the government to address senior hunger, so that there can be no ambiguity as which agency should be doing what. And those agencies, and I'm not going to go through all of it because I know you guys want to hear it, but the Department of Aging and Community Living, the Department of Human Services, we've already talked about how we want them to reduce application and recertification requirements with respect to senior participation in SNAP. The Office of the State Superintendent of Education to help identify and provide technical assistance to adult care centers that are currently not participating in the federal child and adult care food program. The Department of Healthcare Finance is being asked to expand services in the elderly and persons with disability waiver, and to require case managers to screen for nutritional needs and food insecurity. I urge the committee to listen to the individuals testifying today, particularly our older adults, then review, pass, fund, and seek implementation of the No Senior Hungry Omnibus Amendment Act of 2021. Thank you for providing me the opportunity to comment on this critical piece of legislation.
Thank you very much for your testimony. Next, we'll hear from Ms. Asfa.
Hello.
Hello.
It's an honor to be in front of this committee today, especially you, Chair Bonds, and author Che for this amazing legislation. I really appreciate this opportunity to testify on the No Senior Hungry Act. My name is Martha. I'm a very proud Ward 7 voter. I look forward to meeting many neighbors from today in the future. I have the privilege of helping seniors apply for SNAP on behalf of DC Hunger Solutions. I bring special greetings, especially from Mr. Daryl Colbert, Ms. Belton, and Mr. Washington. They are not Zoom members, otherwise they would be speaking on their own, but I've included letters from them in my testimony, which I just sent in. All of them, I think, are courageous leaders who advocate for the dire need for clear communication, a shorter SNAP application, and one agency in charge of ending senior hunger. I have a very intimate window into seniors' lives across the district when I help them apply for SNAP benefits. DC Hunger Solutions is often seniors' last hope for accessing SNAP after struggling to navigate the bureaucracy. Ineffective communication is a common frustration. Mr. Colbert shared, "I had no luck getting answers when I called for help." Mr. Washington stated, "I had to constantly argue with everyone on the phone. Everyone was passing the buck." Ms. Belton shared, "I feel like I've been trampled on when I'm trying to get help." This act's charge to develop a centralized communication plan will provide clarity over what each program does, who is in charge, and how to apply. This will be common knowledge and not just for those who are connected. As a community organizer, I know this will go a long way. In addition, this plan must include training for workers on how to deliver dignified customer service. As Ms. Belton shared, disrespect has lasting impacts on our health and it must be addressed. The current SNAP application takes over an hour to complete. It's technical, invasive, and requires lots of verification documents. I speak to countless seniors who get overwhelmed by the process and gave up. Other seniors like Miss Belton applied and had their documents lost. Mr. Colbert had his benefits held up by 2 months because DHS needed a copy of his Social Security income, which they already had. Imagine both of our frustration. Therefore, I'm beyond ecstatic that this act requires the implementation of the Elderly Senior Application Project, which is, yes, because it restores dignity by asking fewer questions. I often am so embarrassed asking the millions of questions. I'm going on a tangent, but working from home, I had my elderly parents in the house with me when I would be asking about applications and the questions, and they were mortified over the questions that I have to ask. This restores dignity by just asking only the required questions. And it requires them to utilize the information they already have from Social Security and Medicare alike. I honestly think this is a game changer for providers like me and seniors across the district. I am super excited this puts the Department of Aging and Community Living in charge. And it forces effective collaboration with existing partners. So many seniors are in crisis and require multiple services at once. I constantly feel anxiety not knowing where to refer them for services. Being able to refer to just one agency and know they'll take a holistic approach to helping each senior will be a big relief. This will also save the seniors time and prevent them from spinning their wheels. I will close by sharing overwhelming support for this act that I gathered from seniors at the mayor's senior holiday party. Many of them said they spoke with you as well. The image is included in my testimony. This card gives voice to the support that they share for this act and their desire to care for each other. With signatures from zip codes across the district, we want to become the city where no senior goes hungry. I would argue that this act ultimately is about dignity, and it is my hope, and it brings me deep joy knowing the impact that it will have. And I thank you so much for your time and urge you to pass this bill on Valentine's Day.
Thank you very much for your testimony. Thank you. Do we have others that we're going to? Okay. All right. Okay. Thank you.
For this panel.
All right. Thank you so much for your testimony today. And I must just comment that it's great to see Dr. Wheeler. I remember her early days lobbying and screaming about food nutrition. You've got to do something. And I appreciate those apples that you left me as well. So thank you so much. This is like a homecoming for you to finally have a bill like this before the public and before the legislative body that may move forward. All right. So thank you. Thank you all for your comments. Councilmember Che.
Again, I don't really have any questions, but I do want to thank everybody who participated, in the process leading up to this, but also testifying today. But I have forgotten something very important here. I want to thank publicly now Ariel Ardura on my staff, who really managed the whole process and was really the key that brought it all together. So Ariel, I know you're listening. We love you. Thank you very much. Thank you, Councilmember Bonds.
Yes, surely. Thank you. Thank you very much. So we'll now move to our next panel.
Panel
Amelia?
5, yes, panel 5, we have Kathy Pointer, Director of Kingdom Care Village, Joan Williams, Senior Director of So Others Might Eat, Lucy Boyce, and Alyssa McClellan, co-founders of DC Food Project. Carmelita Lacey, public witness.
All right, we're ready to start with Ms. Pointer.
Well, good afternoon to Committee Chair, Councilmember Anita Bonds, to our Ward 8 Councilmember White in his absence, to Councilmember Shea, other members of the council, and all that are present today. I first want to thank Councilmember Bonds for holding this hearing and considering, again, this legislation as a matter of importance and urgency. On behalf of the district seniors, I thank you, Councilmember Bonds, for your consistent commitment to hear our voices about senior services, which deserves the highest level of attention, action, and implementation of policies, programs, and legislations such as is before us today. My name is Kathy Pointer. As director of the Kingdom Care Senior Village and co-pastor of the Greater Fellowship Full Gospel Baptist Church, both in Ward 8, the matter of food insecurity, particularly related to seniors, is of paramount concern and has been for many years. Although COVID has brought light to this issue on a higher level, it is a long-standing problem. If we receive 10 calls during a day, on average, 8 are about food. We open a food pantry every Tuesday morning at 9. The line begins to form around 7:30, if not earlier. All are not seniors, but many are on buses, in wheelchairs, walking, however they can get there, standing in line for not bags of groceries, but something to help for one more week, one more meal. And may I add, the last few days in 20-degree weather. This speaks to not a want, not a luxury, but a need. Although we attempt to address the issue as best we can, as many other organizations, which we heard today, do, the underlying issue is capacity, resources, of course, money, but also manpower, the ability to assess specific needs, nutrition expertise, distribution and delivery, and not feeling you're in a fight that you cannot win alone. We have the heart, but we need the help. The problem is bigger than one organization, even the district government. So I'm pleased to see this proposed legislation that tackles what I call a monster from a collective and collaborative approach focused on ending senior hunger in our ward and certainly in our entire city. I do want to take a few minutes to thank Director Newland at DACO for providing some support to the villages to help in some ways during this period of COVID, adjusting policies during the pandemic that allows us to address grocery needs that we may become aware of, but on a very small scale. Also supporting a program for a few months that allow us to partner with a local farm to deliver fresh fruits and vegetables, and a second delivery with proteins, fruits, and vegetables. And I heard a senior say earlier today, also with a variety of foods that they can enjoy. As with many things, sometimes we just don't know what we don't know. We can't relate to what we have not encountered. And we say to those who may not know or may be a bit removed, this issue is a real problem. Many seniors can't get to a store, as has been stated in the proposed legislation, for transportation, mobility issues. And can I tell you that some are just in so much physical pain, like my mom, or don't feel mentally or emotionally strong enough to go out. And then there are some plagued with fear, not comfortable going out, and who can blame them? Then there's the issue of when they get it. Can they use it? I've seen seniors where the bags and boxes may sit for days because nobody came into the house to put the foods up. They stay there on the counter. For some, their hands are fragile and weak. They can't even open the can. And some cannot stand long enough to cook a meal, but they still deserve the basic right to eat and to eat well. I agree collaboration across agencies and organizations will provide seniors with the best opportunity to eat every day of the week without worry if they will get another meal, how they will get another meal, and when they will get another meal. And I just believe, again, that with organizations pooling our resources, pooling our support, our energy, our thinking, our thought process together, that we can make this happen. Councilmember Bonds, as I thought about and was prayerful about this hearing today, for me, it boils down to one simple statement. We have a responsibility to provide every senior in the district with the right to eat consistently without worry of what tomorrow will bring, and to eat in the best way possible to promote good health. I do have a few recommendations. I heard someone say earlier, maybe teaching seniors how to use their EBT cards, where they could actually purchase food online and have it delivered. They can get things of their choice, things that they want, things that they can use. Also, I just want to caution, I've been reading very closely the proposed legislation, and just want to caution that the committee would really look at that in terms of priority, so we don't get bogged down in too many things and try to stretch too wide and we're not able to get anything accomplished. So I'm just really excited about the legislation. Thank you again, Councilmember Bonds. Thank you, Councilmember Shea, all of those who've been involved. And thank you for this opportunity to share a few thoughts this afternoon. Thank you very much.
Thank you very much for your testimony, Reverend Pointer. Thank you. Now we'll hear from Ms. Williams. I see Ms. Williams.
Hi, nice to see you.
You too.
Okay. Greetings, Councilmember Bonds and members of the committee. My name is Joan Williams, and I am the VP Senior Director of Senior Services at So Others Might Eat, also known as SOM. Thank you for the opportunity to give this testimony in support of the No Senior Hungry Omnibus Amendment Act of 2021. Some believes that our city has the resources and infrastructure to ensure that every senior has daily access to healthy food. We believe that this bill will improve communication, coordination, data collection, planning, and implementation to help make this a reality. SOM is an interfaith organization, provides comprehensive services to our district neighbors who are homeless or at risk of homelessness. In 1983, SOM began offering essential senior programs specifically for isolated and at-risk low-income seniors. These services include a senior center, which offers daily wellness activities, health literacy programming, and monthly food deliveries. Our homebound senior program, which provides long-term case management and care coordination to isolated seniors in wards 5, 6, 7, and 8. And most crucial is our Keener Place, the district's only temporary housing placement for abused, neglected, and exploited seniors. In addition to our DACL-funded programs, some Senior Services operates Keener House, which provides 42 permanent affordable housing units to low-income seniors in Ward 8, and most recently opening our second permanent housing building for seniors called Caron House, which is located on the historic Walter Reed campus. Caron House provides efficiency apartments to 40 of SOM's most vulnerable seniors who not only meet the criteria for all of our senior services programming, but who have also experienced homelessness and need intensive case management and stabilization services. SOM supports the passage and full funding of the No Senior Hungry Act, and we have the following comments and recommendations that we hope will enhance the bill's effectiveness. First, regarding the Interagency Senior Food Insecurity Task Force, SOM recommends increasing the number of proposed senior members. As written in the bill, it only requires that 2 of the 13 members be seniors. Persons most impacted by the issue of senior hunger should be in the strongest position to help recommended solutions. Additionally, SOM recommends that the members of the task force represent living and or working in every ward of the city. This promotes equity and inclusion and ensures that every senior is truly represented by the task force. Second, SOM would like to emphasize the importance of Section 312.3c, which states that the Senior Food Security Plan should recommend strategies to improve the nutritional quality of food served to seniors, including increasing the amount of local fresh produce provided by our congregate meals, home delivered meals, food boxes under the Emergency Food Assistance Program, the Commodity Supplemental Food Program, and other nutritional services programs. This is essential because we must take into account the prevalent chronic health conditions that impact our seniors' diets. Many people mentioned diabetes and high blood pressure throughout today's hearing, so I know that this issue has been emphasized. In our own SOM Senior Center, seniors have expressed concerns about the congregate meals containing too much sugar or too much sodium. They've expressed similar concerns with the home delivered meals. So we need to make sure that as we seek to end senior hunger, we do it with the special nutritional needs of our seniors in mind. Third, it is well known that the food insecurity of seniors can be highly attributed to social isolation and a lack of coordinated care between the different governmental and non-governmental partners. Some believes that there are great ideas outlined in Section 310, the Seniors Communications Plan. We would recommend that mailers be sent at least twice a year rather than annually. And we hope that annual trainings for government employees would include teaching how to easily screen for food insecurity by asking appropriate questions. DHCL should not be the only agency consistently doing screenings. And then lastly, barriers such as poverty, lack of transportation, limited access to internet devices and broadband internet, mobility issues, physical injuries, illnesses, and cognitive decline impact our seniors' ability to access healthy meals. We know that these barriers are most prevalent for Black seniors living in Ward 7 and 8. Therefore, to be most effective, this bill must assess and propose strategies that address how racial inequities create and perpetuate senior hunger in DC. Some recommend that the City Council work with the Council on Racial Equity to ensure the response to senior hunger is done through a racial equity lens. We also recommend that DCL and Interagency Senior Food Insecurity Task Force be required to work with the DC Office on Equity in its planning and implementation of various components of the bill. Some thanks you for the opportunity to offer these comments and participate in the No Senior Hungry work group sessions that led to the creation of this bill. We also express gratitude to Councilmember Mary Che and our senior provider community partners. Thank you.
Thank you very much for your testimony. Next, we'll hear from the co-founders of DC Food Project, Ms. McClinton and Ms. Lebelis. Is that correct?
It's almost correct. It's Leblois, but you're close.
Okay, okay. Forgive me, please. Okay.
Totally fine.
All
Thank
right.
you so much. Thank you very much. We're happy to be here. My name is Lucy Leblois, and this is Alyssa McClellan. We are the DC Food Project co-founders and moms to children in DC public schools. We would first like to thank you, Chair Anita Bonds, for convening this hearing and considering this bill. Also, thank you to Council Members Che, Anita Bonds, Vincent Gray, Janice Lewis-George, Charles Allen, Christina Henderson, Brooke Pinto, and Trayon White Sr. for introducing this legislation. We, DC Food Project, are here today to offer our full support for the No Senior Hungry Omnibus Amendment Act of 2021. Our organization's mission is to tackle food insecurity, specifically among school children. But what the pandemic quickly brought to light is the crisis seniors in the city are also facing. It does not surprise us to hear that the district has the highest food insecurity rate amongst the United States. We have been seeing it firsthand over the past 2 years. When the pandemic hit and schools shut down, our team quickly pivoted all of our programs and launched an emergency bag program, distributing well over 2 million meals over the past 2 years. What we did not anticipate were the seniors who, week after week, day after day, have come to line up and ask for help. So we did, and we continue to do. We wanted to share with you all today what we have seen and what we have learned. First, there are significant gaps. We have heard and of course acknowledge the gaps in wards 7 and 8, but we also are here to let you know that there are a myriad of programs in place throughout the city, but specifically wards 1, 4, and 5 have fallen through the cracks. These are examples where our organization, DC Food Project, in partnership with DC Central Kitchen, have done much of our work. Many seniors have told us that we were the only ones coming to help them, that their communities have felt forgotten. Lack of access. For many seniors, the ability to leave their homes or find adequate transportation is simply not an option. We've heard this over and over today. More often than not, we provide multiple bags of food to seniors who in turn take them to neighbors or relatives stuck at home. And finally, lack of information. Ultimately, for many seniors, they simply have not known where to get help and how to get help. Many have told us they are not aware of programs the city has to offer. They do not know how to access them, and they do not know how to apply.
We are here today to not only implore you to pass this bill, but to consider the following.
As you consider creating an interagency senior food insecurity task force, we strongly suggest that you include organizations who are on the ground, who keep a pulse on how programs are working, identify what is missing and where the gaps are. This will be a crucial element in the overall approach as the group advises the mayor and prepares the senior food security plan. Community is key. Do not underestimate the power of a neighborhood. For many seniors, their community is where they feel safe. It is where they get their information and how they provide for one another. It is their hub. It is where they are and is where the district ought to focus most of their efforts. For example, consider food distributions at neighborhood levels. Lean on organizations who are already there, centers that already exist. Consider communicating through neighborhood channels, such as the ANC, a neighborhood listserv, street signs, and as Ms. Evans stated in the beginning of this call, flyers. It works, they work, we do it as well. And learn about the needs of each neighborhood, the languages spoken, the food that is needed. One of the many lessons we have learned along the way is to ensure that the process of getting food to those in need remains dignified. Lean on local partners. As aforementioned in the beginning, it would be of the utmost importance of the mayor and the council to lean on partners who are on the ground organizations, nonprofits, local government, and residents, as they, as we, are the eyes and ears of the community and advise and support to ensure our seniors' needs are met. We applaud the council for being champions of this issue and for authorizing this legislation as to the committee and for consideration of this bill. Thank you.
Thank you very much for your testimony. I think we have one more for our panel. Ms. Lacey. All right, you're on, Ms. Lacey. Yes. Hello, how are you?
I'm fine. Good afternoon. My name is Carmelita Lacey, and I am a native Washingtonian residing in Ward 7. And I am also visually impaired. Passage of this legislation and the passage of the Senior Food and Security, and the creation of the Senior Food Security Task Force will create a clear process for seniors to follow and amplify the voices of seniors, as has been done by many of the panelists today. I care about seniors with regard to food insecurity because there is a direct link between good health and good nutrition. Ward 7 has one of the highest underserved populations in the city. There is a serious lack of access to quality foods. Grocery stores, open air markets are almost non-existent in Ward 7. So the issue of wood deserts needs to be addressed at some point. The issue of I care about this issue because DC is my home and because DC seniors deserve easier, more accessible, comprehensive, and quality nutrition. As a native Washingtonian, I was shocked to hear that DC has the highest percentage of senior food insecurity in the nation. Since there are so many food resources in this city, this legislation would centralize access to food programs and services. And it is critical to create a central primary place where we can go and connect with those programs and services. Just makes sense to me. Additionally, having the Department of Aging and Community Living as the in charge of the oversight is exactly what needs to happen, because many of us seniors are aware of the the DACL. We go to them. We go to the Department of Aging. So that's a good start in terms of this task force. There's a lot of collaboration and coordination needed to make this effort successful. It shouldn't take years to see these important changes become a reality. I appreciate the educational component proposed in this legislation and the involvement of seniors who have relevant experience with regard to food insecurity. Please keep our input and concerns at the forefront as this legislation moves forward. Thank you to the entire City Council. Thank you, Council Member. Oh God, I'm sorry, my eyes are running. This legislation, Council Member Bond for introducing it, along with Council Member Che. This legislation has my full support. And I hope that the City Council will pass this legislation, will make this legislation law. Thank you.
Thank you very much for your testimony. I think that concludes our this panel. I would just want to add very quickly that we appreciate all of your comments. There are some things that you have introduced that are new to what is being proposed. So we want to make sure that we capture that and possibly can include it in the legislation. So I'll turn to Councilmember Shea, the primary author of the legislation, for any comments or questions she may have.
Thank you, Councilmember Bonds. I want to thank all the witnesses and people who participated, in putting this all together, and the many suggestions that people have given. I just want to focus on one. I think it was Joan Williams who was talking about this, and it was the idea that we need to have training across agencies for our employees, and it underscores a particular point that has come up many times, actually. I chair a committee for the Council of Governments. It's a regional committee on nutrition and agriculture and that sort of thing. And it's come up there, so it's not just something isolated to us, which is when people come forward and they need to have some help with food or nutrition, they probably have need for help or support with many other things. So we have to be prepared in every case to have people who are aware of the many services that we have and be able to make proper referrals. It's not, usually a one-off situation for many folks. So that idea about cross-training, so to speak, our employees in different agencies is an excellent one, and it will get us along that path to not think about things, atomistically, but to think about them comprehensively and offer advice and help to people when they come to us for one problem to see if they have others. In any case, thank you all very much.
Thank you again to the panel for your presentations and helping us to, we believe, improve on this legislation. Thank you very much for your testimony. And we'll now move to panel 6.
Yeah, this is going to be the last panel, council members. So we have Frank Finnemore, Executive Director of Cleveland and Woodley Village. Zachary Curtis is absent. We have June Bing, CEO of Iona Services, and Eva Lucero, Executive Director of DuPont Circle Village.
All right. Well, we'll start with you, Mr. Fillmore.
Great. Dear
Okay.
Chairperson Bonds, Councilmember Che, committee members and staff, thank you for the opportunity to provide input on the No Senior Hungry Omnibus Amendment Act of 2021. I'm Frank Finnemore, a 4th generation Washingtonian, current resident of Woodley Park, and the executive director of the Cleveland and Woodley Park Village. Villages are neighborhood-based charitable nonprofit organizations that create opportunities for older adults to be actively engaged, support those who need it with volunteer assistance to help them live independently, and work to create a welcoming community for people of all ages. I'm testifying today because as part of our services to help older adults remain living independently within our communities, our village, Cleveland and Woodley Park Village, has a small-scale meals program whereby neighbors help neighbors deal with food insecurity. Our meals program began during the pandemic as a result of neighborhood families that wanted to engage their children to help vulnerable older neighbors during a time of crisis. Today, I'll share a bit about what I've learned over these past 2 years about food insecurity and what it looks like from my vantage point delivering meals and being in the homes and refrigerators of many older adults in Ward 3. Let me begin by saying that I too was alarmed when I read Feed America's latest report, The State of Senior Hunger in America, that the rate of food insecurity among seniors in the district is 14.3%, the highest rate of food insecurity among seniors in the country. Of note to me was the fact that every question of the 18 questions used by Feed America to measure food insecurity in some form or another included a statement about money or the ability to pay or afford food. Based on my experience personally preparing and delivering food in a volunteer capacity for my own organization to seniors in Ward 3, there are multiple obstacles, including but not limited to money, that contribute to food insecurity among seniors. Certainly, the inability to afford food is a real issue for some within Ward 3. While not prevalent among the members that we serve, there are people in our midst that cannot be overlooked based on where they live. For example, one member who receives weekly homemade meals from us indicated that without those meals, everything that he would otherwise eat would be out of a can, because a substantial portion of his fixed income goes to rent, utilities, and medicine. Fresh fruit and vegetables are simply not affordable. Another member lives solely on Social Security, which barely covers her rent and utilities, leaving little else for other things, including groceries. On a personal note, let me add that during COVID, my family and I put up a little food pantry on Calvert Street Northwest, which we affectionately refer to as the Calvert Cupboard. This pantry is not a program of the village, but I'm raising it here because I think it has relevance to food insecurity within the ward. Each day when I walk my dogs multiple times, I see the donations that come and go in this 24/7 accessible pantry. It's astounding how much food passes through it, which we estimate was around 3,000 pounds last year alone. People have left notes of thanks and told us that they couldn't afford food. I don't know the recipients. I don't know where they live or how old they are, but I do know that I can't keep enough non-perishable goods in our humble little pantry right here in Ward 3. Another major challenge among some older adults is the ability to shop for and prepare their own meals. This situation is likely not captured by Feed America's survey. For many older adults, the inability to travel to get groceries or order them online, as well as health challenges, prevent them from preparing their own meals. They want to age in place, and although we know that there are major benefits to aging in one's own home, the inability to cook remains a large obstacle to some in doing so. For example, we have one member, age 95, who is difficult seeing, which affects her ability to cook. The meals we provide allow her, perhaps more than any other service that we provide, to stay living independently in her home of 50 years. In this case, poverty is not the reason why this woman sometimes goes hungry, but rather the inability to prepare food is primary. I should add that I know that she's been hungry in the past because I've called to check on her. She's cried and told me that she was hungry. Of course, we immediately delivered more meals, but that cry for help has stayed with me. Not everyone who can afford food is able to access ingredients or prepare meals. To complicate matters, this woman is reticent to receive meals from the city because she's never had to access any city services previously and doesn't want to see herself as weak or needy at 95. I applaud the city for addressing food security as one of the most basic needs. No one should go hungry, and certainly not in our great nation's capital. I hope that any proposed legislation recognizes that hunger exists throughout our city in large swaths, as well as in pockets within every ward. But any proposed legislation must also address other reasons why seniors are hungry. Thank you for your time.
Thank you very much for your testimony. I believe Mr. Curtis.
It would be Mr. Bing, actually, from Iona.
Okay, all right, Mr. Bay, you're up.
Great. Madam Chair, Councilmember Che, and distinguished members of the Committee on Housing and Executive Administration, my name is Jun Bang, the Chief Executive Officer of Iona Senior Services. On behalf of the Iona community, we applaud you for taking a stand against food insecurity affecting our older adults in the district. When I joined the organization 5 months ago, my first client visit was at the Regency House, the only public housing available for older adults in Ward 3. Of the 140 plus Regency House tenants, and over 40% have one or more disabilities, and nearly 80% of them live alone. And unfortunately, these percentages, while extremely high, are not too far off from the stark realities of the compounding needs and difficult life experiences of many of our aging residents across the city. This client visit was a part of our Food Pantry Plus delivery. It's an Iona program developed to meet the needs of our most vulnerable older adults who are unable to go out to buy food or essentials because of immobility caused by physical or cognitive impairments, income insecurity, abject poverty, or simply because of the lack of transportation access. As we made deliveries, one client welcomed us into his home. His relationship with Iona began 7 years ago when he found help with his lapsed SNAP benefits and housing application. Rose, Iona's licensed community-based registered dietitian nutritionist, intervened when he was identified as being food insecure and at high nutrition risk just a few years ago. Since then, he began receiving home delivered meals. And as I listened to their conversation during this visit, I witnessed something much more meaningful than just the act of making a food delivery. I saw trust and friendship in their interaction. I learned through them that food security, while it must begin with access to nutritious meals for all older adults, it's also about building community with our older neighbors forged by genuine human connection and care. Over time, the two have worked together for him to receive nutrition support specific to addressing deficiencies that were exacerbating his chronic diabetic leg ulcers caused by his paraplegia and other health challenges unique to him. Rose and members of the Iona team served as a link between him and the access to the resources that helped him continue to live and age in his community. His life experience is just one of the 12,000 plus individual and unique experiences of our older adults living in poverty in our city, the vast majority of them unnoticed and invisible to most of us. For this reason, we support initiatives that seeks to reduce barriers for vulnerable individuals as they age, especially so if it means we are able to create equity and access to important resources to support their needs. There are two elements of the No Senior Hungry Omnibus Amendment Act of 2021 we believe can be achieved sooner than later: the Elderly Simplified Application Project, ESAP, and the addition of home delivered meals to the EPD waiver. SNAP is considered the most effective tool in combating food insecurity impacting older adults in the country today. However, only 46% of the district's eligible older adult population is receiving this benefit. And research has shown that stigma, misunderstanding of eligibility, and barriers during the application and enrollment process are 3 key factors for underutilization of SNAP. We are in favor of the steps outlined to increase SNAP participation and highly support the adoption of the ESAP. Also, the EPD waiver home delivered meals would provide a valuable prepared meal resource for disabled adults aged 18 to 59. Last month, our nutrition team received a referral for a 57-year-old EPD waiver eligible client who is desperate to find a home delivered meal program he qualified for. Living alone and recently released from the hospital, he suffers from multiple chronic conditions, including debilitating congestive heart failure. He was unable to shop for or prepare appropriate meals for himself and could barely afford to buy food. In addition, we respectfully ask the City Council to invite and fund community-based organizations and anchor institutions to develop outreach strategies tailored to meet the needs of our diverse and multicultural aging communities. There's no one-size-fits-all solution to support the unique and diverse needs of vulnerable populations. We also believe that it's really important to acknowledge that passage of legislation and policy change takes time. Time many of our older adults simply do not have. I began this testimony by sharing with you about my first Iona client experience. Unfortunately, that gentleman passed away just a few months ago. Ultimately, the health of any society depends on how we treat the most vulnerable among us. No older adult should go hungry in this country, and certainly not in our nation's capital. Please move with urgency to support the needs of our communities. I thank you for your time and the opportunity to comment.
Thank you for your testimony. Thank you very much. And finally, we are at the DuPont Circle Village. Miss Lucera, welcome. There you go.
Sorry about that.
That's
Good
all
afternoon,
right.
Chairman Bonds. Happy Valentine's Day.
Same to
Good
you.
afternoon, staff and members of the committee. My name is Ava Lucero. I am the executive director of the DuPont Circle Village, a community-based service organization in partnership with older adults in the neighborhoods of Adams Morgan, DuPont Circle, and Kalorama in wards 1 and 2. I am also a 30-year Washington resident and live in Ward 3. I am here to testify in support of the No Senior Hungry Omnibus Amendment Act, not only as the director of an organization that serves older adults, but as a concerned citizen. At a council hearing last year, I first learned that DC has the highest percentage of senior hunger in the nation. I was totally taken aback by this astounding and heartbreaking ranking. With so many programs in our city that address food insecurity, I believe there are roughly 90 publicly provided benefit programs available to DC seniors, many addressing food and nutrition. How is it that Washington, DC leads the nation in senior hunger? I have since learned that food insecurity for our older adult community is not because a lack of food and nutrition programs or resources. The issue is a disconnect between the programs and their ability to reach the people who need them the most. As have been explained in numerous testimonies today, some of the barriers to reaching our aging neighbors with healthy meals include lack of transportation, mobility, poverty, physical injury, illness, access to technology, and the complexity of the application process, which someone recently testified is over 60 pages long. It seems kind of outrageous. It is important to recognize that the seniors most impacted in our city continue to be residents of color. Obviously, reaching local seniors is a complex challenge. However, I strongly believe the action items outlined in the amendment is a critical step to help resolving this issue. We cannot wait. Addressing senior food insecurity is an urgent issue and we must act now. I call on Mayor Bowser and this committee to prioritize actions detailed in the amendment. to address the senior hunger in the FY23 DC budget. For DC to truly be an age-friendly city, our older residents must not feel anxious about when they will have their next meal. DuPont Circle Village is doing a small part with our Meal Maven program, and we have designated funding sources that address food insecurity among some village members. If this amendment passes, the DC Village Network would be a tremendous support to assist with the proposed comprehensive communications plan on this issue and in ways the city will improve the delivery of the services to those in our aging community who need it most. The villages are located throughout the district and are capable of cross-promoting DC services with their own referral systems. All information can be on each DC Village website, on our combined DC Villages website. And I think that village personnel should be included in any task force that are created to implement the communications plan. I'd also like to mention that the two women testifying from the DC Food Project who stressed the resources that are available in local communities within the neighborhoods is exactly what the villages are all about. We can get this message out to those who need it most. In closing, thank you for hosting this important public hearing, Chairman Bonds. Special thanks to Council Member Che, who introduced the amendment. And I'm also grateful to Council Members Vince Gray, Janine Lewis-George, Charles Allen, Christine Henderson, Brooke Pinto, and Treyon White, who signed on as co-introducers and are all willing to address this critical issue head on. I'm very happy to answer any questions you may have or suggestions.
Well, thank you all very much for your testimony. I think you all are correct in that we have heard many of these comments before, but there are a few new ones that you've added to the table that I think the idea of including villages in membership of the task force is something that we really need to look closely at. And I'm especially intrigued when we think about the number of programs that we do have available in the city for our seniors. And I think one of the goals has to be, Councilmember Che, to see how we can connect those programs to this task force effort. But I will turn to Councilmember Che for making comments, asking any questions. All right, well, perhaps she has stepped away. Okay, Councilmember Che, do you have comments or questions?
Again, I don't have any questions. I just want to thank the panel for their testimony, and I look forward to hearing our government witness. Thanks.
Yes, thank you all very, very much. And I must say that one of the ideas too that is very intriguing is the food pantry. So let's see how we can explore that example and make it a part of what we're trying to do to address food insecurity and nutritional needs for our seniors. So thank you all very, very much. Thank you. Nice to see you. At this time, we're going to take a maybe a 10-15 minute break before we bring on our government witnesses. But I especially want to thank everyone for your testimony today from all of our public witnesses. And we will return at 1:30 to hear from our government witnesses. So we'll take a quick break. Thank you. Amelia?
Yes, we're ready. when you are.
Okay, all righty, thank you. Again, I want to thank our public witnesses for taking time out of their day to share their perspectives on the legislation and on issues that the bill aims to address. Now we will hear from our government witness, which is the director from the Department on Aging and Community Living, Dr. Laura Newland. And I dub you a doctor because of the tremendous work that you must produce for all of our senior citizens and aging community members and those that assist our aging community every day. So I would like to swear you in. If you would raise your right hand. Do you swear and affirm that your testimony and any statements that you make before us today to be truthful and complete?
Yes.
All right, thank you. We'll receive your testimony now when you're ready.
Thank you so much. Good afternoon, Chairperson Bonds, Councilmember Che, members of the Committee on Housing and Executive Administration, and committee staff. My name is Laura Newland, and I'm the director of the Department of Aging and Community Living, or DACL. I'm pleased to provide testimony on Bill 24-0419, the No Senior Hungry Omnibus Amendment Act of 2021. With me today is Jessica Smith, who is the Chief Program Officer at DACL, as well as the Senior Advisor to the Deputy Mayor of Health and Human Services and Director of the Department of Healthcare Finance, Wayne Turnage. I'm also joined by Melissa Bird, Senior Deputy Director, Medicaid Director at the Department of Healthcare Finance, and Michael Rebar, Deputy Administrator, Division of Policy, Training, and Quality Assurance at the Department of Human Services. The mission of DACL is to advocate, plan, implement, and monitor programs in health, education, and social services for the elderly, to promote longevity, independence, dignity, and choice for aged district residents with disabilities regardless of age, and caregivers, to ensure the rights of older adults and their families and prevent their abuse, neglect, and exploitation, to uphold the core values of service excellence, respect, compassion, integrity, and accountability, and to lead efforts to strengthen service delivery and capacity by engaging community stakeholders and partners to effectively leverage resources. Before I get started, I'd like to thank Mayor Bowser for her leadership. Combating the interrelated issues of isolation and senior hunger has been a focus for our mayor since she took office. Since I came into my role in 2015, we've invested $8.5 million annually in food alone, and in FY 2020, we invested $14.5 million, and in FY 2021, Mayor Bowser invested more than $18 million in food alone as we responded to the needs from the public health emergency. Mayor Bowser continues to make food access a top priority throughout her administration and has launched several initiatives to expand food options and choices for residents across the district. This includes a $58 million food access fund with the goal of eradicating food deserts and creating more employment opportunities. The FY22 Budget Support Act changed the supermarket tax credit to focus eligibility to areas most in need of grocery stores, expand support to more fresh food retailers, and add community engagement requirements for grocers. Mayor Bowser's investments prioritize equitable food access, particularly in Wards 7 and 8. As a result, more than 162,000 residents will gain food access points within 1 mile of their home. And yet, we know that there continues to be more work ahead for all of us if we are to end senior hunger in the district. Madam Chair, according to a 2019 study by Feeding America, DC has the highest rate of senior hunger in the nation, with 13.5% of seniors reporting that they are food insecure. We also know that the past 2 years have likely only exacerbated this inequity. In a city like ours, with a mayor who is committed to inclusive prosperity for every resident, with strong leadership and investments into programs that help our residents thrive, one senior going hungry is one senior too many. We can do better. As we continue to work together to ensure an equitable recovery for all residents in 8 wards, ending senior hunger continues to be a top priority for Mayor Bowser and for DACL. Senior hunger is a highly complex issue. The U.S. Department of Agriculture defines food insecurity as a lack of consistent access to enough food for an individual to lead an active and healthy life. Although hunger and food insecurity are closely related, they are distinct concepts. While not every person experiencing food insecurity is hungry, we never want a senior to wonder where their next meal is coming from, or need to replace healthy food options with cheaper, unhealthy options. In January 2022, DACL brought our home delivered meal program, previously run by lead agency grantees, into the agency. Over the last several months, we've built an internal nutrition services team led by Ms. Paulette Costley, a dietitian who previously worked in the Senior Service Network and brings decades of experience working with district seniors, and our 9 very capable and committed staff members. This team got to work right away, assessing the 1,300 seniors who still remained on the COVID emergency meal list, transitioning them to long-term programs that best fit their needs. And they've also spent time meeting with other local agencies and nonprofit partners, including DC Central Kitchen, Mary Center, We Are Family, and Hungry Harvest, to discuss possible ways to collaborate as we move forward. In addition to these activities, our team is regularly participating in meetings with the Office of Planning's Food Policy Council, a coalition of food leaders and government representatives appointed by the mayor to drive policy towards a more equitable, healthy, and sustainable food system in the district. Government members include the Department of Human Services, DC Health, Office of the State Superintendent of Education, Department of Small and Local Business Development, Department of Energy and Environment, and the DC Office of Planning, along with several nonprofit and private entities that operate in the food space. The Office of the Attorney General, DC Public Schools, and the Department of Healthcare Finance also regularly participate in meetings with DACL. As DACL's new in-house nutrition team continues to build capacity, we're excited to expand our service offerings beyond our current congregate dining sites and home delivered meals programs to ensure we are meeting each senior's unique needs. In FY21, DACL worked with Mary Center to pilot a new senior nutrition program called Eat Well, Live Better. This program links medical care, nutrition, and social supports to improve health outcomes for low-income seniors with chronic health conditions. Participants receive grocery box deliveries twice a month, as well as individualized nutrition education and coordinated care with their healthcare providers. Mayor Bowser has invested $646,000 to continue this pilot program into 2022. While DACL provides daily meals at more than 40 community dining sites throughout the city and weekly meal delivery to homebound clients through our home delivered meals delivery program, we know that there are other ways to better meet seniors at their point of need. This fiscal year, the mayor has invested a total of $850,000 for senior villages throughout the city to expand and diversify their membership and their programmatic offerings, including food access, and $2.5 million to launch hyperlocal, neighborhood-based socialization hubs to increase outreach to older adults. DACL worked closely with our lead agencies to develop unique plans for their neighborhoods that would combat senior isolation and end senior hunger. These plans include mobile food pantries, shuttles to grocery stores, pop-up community events that feature programming and food distribution, as well as connection to long-term nutrition programs, senior farmers markets, and a redesign of the community dining experience. We're excited to see what happens over this next year and how these hyper-local strategies can help end senior hunger in DC. But we know that regardless of how great our programs are, it won't matter if seniors don't know how to access them. DACL uses a multi-channel outreach strategy to connect and engage with a diverse range of older adults. We participate in hundreds of outreach events annually in all 8 wards. We did over 200 events pre-pandemic and more than 150 in-person, virtual, and hybrid activities during the pandemic. And they include such high-profile mayoral events like the mayor's annual holiday celebrations and senior symposiums, monthly printed newsletters distributed at sites throughout the city, social media, electronic newsletters, earned local and national media coverage, and engaging our active network of DACL ambassadors on a regular basis. In addition to these activities, DACL, in partnership with our grantees, provides regular programming in all 8 wards, delivered online, in person, and in a hybrid model to reach more residents. Madam Chair, I'm also excited to announce that starting March 1st, we'll be resuming in-person activities and dining at all 6 senior wellness centers and 40 community dining sites. As we move forward, we want to ensure that our decisions are driven by data, research, and best practices on a local and national level. In November, we partnered with George Washington University to analyze our current nutrition program data. Before we made any changes, we want to know who we are serving with our programs. We're looking forward to learning more about how our programs have impacted the lives of our participants and where there is opportunity to improve. In order to achieve these goals, we recently entered into a data sharing agreement with DC Health and are sharing program data to identify overlaps and gaps in nutrition services to ensure that every resident has access to the most appropriate program to meet their individual needs. We're also working with the Office of Contracts and Procurement to issue a solicitation for a partner who will conduct an in-depth review of the prevailing reasons behind the issue of senior hunger in the district. The first phase of this contract, to be completed in fiscal year 22, will consist of a discovery and awareness phase, which will include research with national leaders in the senior hunger space, feedback from seniors in the district, both those who currently access programs and those who don't, and an assessment of the community at large, which will include holding in-depth conversations with community partners, including those who don't work directly on senior nutrition issues. Madam Chair, the mayor and DACL are fully committed to using every tool in our toolbox to end senior hunger. Over the past year alone, we've restructured our lead agency model, brought case management into the agency, built an internal nutrition services team, and launched an innovative pilot program, all while responding to the immediate needs of our residents during the public health emergency, which, as you know, included growing our home delivered meals programs from about 2,400 unique clients pre-pandemic to nearly 7,000 clients during the height of the public health emergency. We know that the work of ending senior hunger will require a thoughtful, coordinated, community-driven approach backed by research. I think we can all agree that much of the commitment, partnership, and work that Bill 24-0419 seeks is already underway. Our mayor has made significant investments in increasing food access across the district and continues to support DACL and our sister agencies in pursuing creative approaches to end senior hunger. Ending senior hunger is a topic that aligns all of us, the mayor, the council, nonprofits, and community members. Coming together as a community and using an innovative, data-driven approach will be vital to addressing this urgent need. Thank you for the opportunity to testify before you today. We are happy to answer any questions you might have.
Councilmember, you're muted.
Thank you very much for your testimony today, and I will do as we did earlier. I'll turn to Councilmember Shea for her questions first or comments, and then I'll have an opportunity to chat. Thank you, Councilmember Shea.
Thank you very much. First of all, it's good to hear that you're going to resume in-person dining on March 1st. I think that's really critical to have that, connectedness. Your testimony basically is, forgive me, but, many pages of self-congratulation on what you're doing, and good for you. And basically you're saying that this is redundant because, well, all the work is already underway. I would have hoped, however, that in addition to congratulating yourself for everything, that you would have been able to speak to the legislation. Do you support it? Don't you support it? Would you add to it? Would you say that we shouldn't even bother with it because you say the work is already being done? Could you address that, which is really the purpose of a hearing?
I'd be happy to. Thank you, Councilmember Che, for that question and for an opportunity to talk directly about this legislation. So, first of all, the testimony was not intended as a self-congratulatory opportunity for DACL. It is true that we take this issue seriously, and we have devoted a significant amount of resources to combating senior hunger. And in my testimony, I say over and over again, it's not enough. We need to do better. And so I certainly agree with many of the witnesses testifying today that we have much work to do. The testimony is very complex. It involves many different components, some of which have, I think, programmatic and federal implications that my colleagues from DHS and DHCF can speak towards. Regarding the communications plan requirement in the legislation, DACL agrees, and we have agreed that we need to do better on our communications plan, and we need to work more, I would say, in concert with the community on effective communication. So there is, as I know in the testimony, some alignment. And then I think there are certainly opportunities to discuss the more technical aspects of the testimony.
Okay, well, I do hope you'll provide to the committee, I'm not a member of the committee, but to the committee, any specificity that you have with respect to actual, legislation. There were a whole variety of suggestions that were made by witnesses, for example. All right, I do have some more specific questions. There was a lot of reference to the fact that, we may have ways to, better ways, increased ways to be in touch with seniors. And I don't know if this is a possible one, but it was something that occurred to me. If you have a list of properties that claim senior tax deductions, do you use such a list, for example, to fashion outreach?
So the Office of Tax and Revenue, they do have that list. In the past, we've been able to use that list to share, basically to do outreach, to connect with seniors, to prevent tax foreclosure on their house. However, with some different kind of changes in relationships, staffing over there, we haven't accessed that list in a while. So that certainly is a good idea to re-engage at that level.
Okay, and that's another example where you may be in touch with folks for one reason, but it naturally leads to other inquiries about what their needs may be. I'm happy to hear that you've entered into this data sharing agreement with DC Health to identify overlaps and gaps in nutrition services. Could you tell me a little bit more how that will work? And once you have the data, how are you going to use it?
So we actually have a memorandum of agreement with DC Health. They operate many senior food nutrition programs, including the Commodities Supplemental Food Program. And so the data sharing agreement is related to that program so that we can compare that client list with our client list. But I am actually going to pass this along to Jessica Smith, who is the Chief Programs Officer. She has been intimately involved in the MOU construction to make sure that we are achieving both of our goals.
Thank you. Good afternoon, Council Member. We're so excited about this data sharing agreement with DC Health. It's going to allow us to do a cross analysis to see if there are overlap in the programs, if we're serving the same folks, which is not necessarily a bad thing, but a thing that we should be aware of. It'll also let us know what gaps there are in the population that we're serving and how we can, as you're talking about, cross communicate and make sure that folks on our programs know about a wide array of services that are being offered. So we're finalizing our vehicle right now for exchanging that data, and really look forward to seeing your results in the next few weeks.
And could you tell me, was there any attempt to reach out to other agencies providing senior nutrition services? Because then, you know, you're eliminating gaps that could arise from those agencies.
Yeah, absolutely. Absolutely. It's a great point. So we just brought our nutrition services team in-house January 1st. We thought DC Health was a great agency to start with, but we are looking forward to working with our other sister agencies as well. This was just our starting place.
Okay. Can you tell us more about the data that GW is reviewing with respect to this current nutrition data? Is it just DACL data, district-wide data? And when do you expect findings from them?
Absolutely. So we worked with GW to provide them with the data from all of our senior nutrition programs. What we're going to be looking at there, and we don't have the results yet, but hope to get them in the coming weeks. But what we're looking from those results will be our demographic data, information on where seniors live that we're serving. Again, being able to identify any gaps that we might have. They're going to take a deep dive into the activities of daily living results that we do during our assessment to see if there are any trends there, and really just trying to dig down into what do the seniors that we're currently serving look like, and how can we find ways to expand our services and cover any gaps that there may currently be. So we're expecting those results very shortly.
In the next couple of months, or does that?
Yes. Yeah.
Okay. Okay. Speaking of timelines, do you have a detailed timeline of the plan to contract with a partner to research the issue of senior hunger in the district?
Go ahead, Jessica.
Yes, that'll be in the spring. We actually just got a draft timeline from OCP, so they're moving right along and hope to have somebody on in early spring.
Okay. And then finally, and I'm going to wrap up here, Councilmember Bonds. Just finally, I'm glad to hear that DACL is proactive in trying to engage seniors to make sure that they're aware of these nutrition programs. Do these outreach efforts include promotion of other agencies' nutrition programs, or just yours?
Yes, absolutely. When we do outreach, we do essentially district-wide outreach. So we work very closely with other district agencies. They're always present at our wellness fairs and activities. And then our outreach folks also are very well educated about the potential programs that seniors might be eligible for. And so that certainly is a part of every single outreach event.
Okay. All right. Thank you very much. Thank you, Councilmember Bonds.
Sure. Sure. Thank you very much. Ms. Newland, I wanted to go back to this data sharing agreement that you have with Department of Health, and how I want to know more about how it will be used. And I asked that question because, you know, consistently over a period of time, my concern has been, and I think your concern as well, that we were not reaching the seniors that might need the services the most. And so I want to understand how this matching of data is going to then be used to reach those folks that probably are in our health programs, but we don't know them. So tell me, please, how you're going to do that, and what's the real purpose for it?
Sure. So I'll let Jessica speak to the specifics of the agreement itself, but I will note that this is really just a step. This is not the complete data picture. This is not going to solve everything for us. It won't find all the seniors for us who need services or might be interested in services. So, you know, we certainly understand that when we work with DC Health, we're working with a district agency, another district agency. And there are, as you heard today, many seniors who aren't connected with district agencies for one reason or another. And so we understand that our outreach does need to be much more expansive than just district agencies, but this is a place to start. And of course, we work with several different nonprofits. We work with like 20 community nonprofits through our network. And so, part of our strategy is to use the data we collect from those nonprofits as well as between agencies so that we can start filling in these gaps. Jessica, did you have anything else to add specifically about that MOU?
Yeah, the one thing I would note is that I agree that it's just a starting step and a starting point rather. And we have specifically drafted it so that we can, as we start digging into the data, we can expand to other programs that may not even be senior specific that DC Health runs. To your point, council member, of really being able to see who are we serving and where some of our pain points or gaps might be. So we're going to start with our Produce Plus and our commodity program and the programs that are specifically serving seniors where we think there could be some overlap. But our intentions are to broaden that to all of the programs that food programs that DC Health is implementing and really see where we could expand DACL's reach as well.
Well, thank you for that information. I'm a fond believer that the more we know about our aging or our older adults in the city, the more likely we are to service them better. And so I'm very curious about this. As you and I want those who are listening to understand that this is not a Big Brother project, hopefully, that this is really service design more than anything else, and particularly helping us to find those that may be isolated. I wonder in your work to craft this database, because that's what you're going to have. That's a database. If it makes sense to think about, and since you, the office served as a member of the task force that created this legislation, I wonder if you have given thought to how we can combine the data requests, the many different data requests we make of our senior population, into one document and an abbreviated document so that we don't have to hear again that it takes hours, 60 pages in order to just access one service. And I would imagine it takes similar kind of energy and effort to access a health, application. So have you thought about how we make the services of the city more accessible to our seniors?
Yes, thank you, Madam Chair, for that question. It certainly is a question that we ask quite a bit, and that's a lot of what we kind of our programmatic work is all about asking ourselves, can we make things easier? Can we streamline things? So I'm sure my colleagues at DHS and at DHCF might want to speak to their specific federal programs that have specific federal requirements. But one example I think that has been really successful of agencies working together on applications is the work that DACL does with the Department of Healthcare Finance. We created a team together specifically for enrollment on their Medicaid waiver. And so we have a team at DACL that helps walk people through and fill out the application to get on the EPD waiver, and will answer anyone's questions throughout that process. And so, as far as we know, that really is the, there's nothing else like it in any other state. I think it's really incredible the amount of work that goes into thinking about how do we reach our most vulnerable folks. So if DHS or DHCF has anything to add.
Well, okay, Ms. Bird. All right, great.
Good afternoon, Chairperson Bonds and Councilmember Che, to other members of the committee and committee staff. Thank you so much for allowing me this opportunity to be here today. I'm Melissa Bird, a Medicaid director for the DC Medicaid program, and I will just continue on where Director Newland started. That not everyone knows what a close collaboration we have, really specific towards the elderly and persons with disabilities waiver, and we've been able to utilize that relationship to build on our outreach efforts. Most recently, we just launched a new program called District Dual Choice, and in order to make sure we were getting out to the community and speaking to people who might be affected or could be eligible for that program, we reached out to Director Newland and her staff, and they were able to go to the senior centers and other opportunities in collaboration with the ACL to make sure that we are getting to the right folks. Specific on some of the application issues and references to the really long application. The original intent in creating what we call the integrated application was also was to respond to beneficiaries and district residents' needs of and concerns about having to fill out multiple applications requiring a lot of the similar information. And so now we have an integrated application, which is lengthy, but once you fill it out, can help you apply for Medicaid, SNAP, TANF, and other benefits. So it's, we try to respond to one thing, which helps folks, it's one application, and it gets you access to several services. They may have that unintended consequence if you are very clear on one specific service that you want. You're filling out a lot of paperwork to meet the requirements for Medicaid, requirements for SNAP, requirements for TANF.
Okay, so I'm hearing right now here that we have a process where a senior, as we discover them, isolated, whatever, that they can go through a abbreviated application process. That's what I call it. Maybe it takes 15, 20 minutes, not an hour and a half, and be signed up for 5 or 6 different programs, right? Am I hearing that? No?
I would say the long application, it is more than 15, 20 minutes. It's also what Director Newland spoke to. So it is a longer application and it connects you to more programs.
So is it an hour and a half to fill it in? Is this is not the 60-page document that we heard it is. We heard so many complaints about. So, oh my goodness. So in reality, there once was a time when it was 250 if you were applying for all of these different things, is what you're sharing with me. So yeah, we celebrate it's down to 60. Oh my goodness. All right. I'm in this zone too. So I'm thinking to myself, my goodness, and I know it's very awesome. So in your process of building this database, can you glean some other characteristics that only need to be collected one time, or by virtue of the condition of the individual, if they only need to, if they fill or have filled out one application, it will lead them to being certified for 5 or 6 other services. Trying to just get, I don't have the application, so I'm trying to figure out, is there some way to reduce the volume of pages even more so? I imagine it must ask how many household pets you have, how many socks you wear on any given day. And I know I'm being a little silly, but I'm just trying to understand the complexity of what could 60 pages ask about your lifestyle that could be meaningful to the government and entitle you to receive life-giving benefits such as food.
So I can speak to the Medicaid portion. A lot of the questions that we have to have information about relate, of course, to income. And it gets into residency, how many people live in your household, age, and where we can derive information, whether it be from the Social Security Administration or other federal databases, we do pull that in. And for the renewal process, it's a fairly automated process that doesn't require that same lengthy application year and out. For other details, I was going to defer to Mr. Rebar from DHS for the TANF and SNAP components.
Thank you, Director Byrd.
Hi, Mr. Rebar. Okay.
So, you know, just like the medical programs, the SNAP program is a highly regulated by the federal government. And so there are a lot of eligibility factors that are similar. Sometimes they're the same as Medicaid, TANF, and other programs. Sometimes they're different. And I think, you know, there is information that we can share and information we can't share. The government has told us that we can't use some of the data that's collected for some of our Medicaid programs that if we used for SNAP would make things easier. So that's been a push from states across the country to push CMS, the federal agency over Medicaid, and the Food Nutrition Service to allow us to share that data so customers don't have to provide it twice. So I can tell you from the senior population and our district residents who might be disabled, we have submitted the waiver request to FNS for the Elderly Simplified Application Project. So we are working through the federal requirements to get that approved for a shorter application just for the SNAP program. And on top of that, we are working with DHCF on a harmonization effort so when you're completing the 60-page application, if it's asking you for income, it's only asking you for income once and not twice or three different ways in different ways, so that we can use that data for the same program. So we are starting those efforts as we speak.
All right, well, I guess to some degree we've exhausted that particular issue, but it does seem that if we're going to get more of our aging community involved in the activities of DACL, that we're going to have to come up with something else. And to me, it's related to the collection of data. And so that's the nature of my concern as we talk about the importance of being housed within the DACL, a database. And I'm just trying to understand how it all fits together and it will benefit the community. You know, that's always my concern. You know, we go through a lot of processes in this government, but not all of them really benefit the residents to any great degree. And we are so famous for collecting all kinds of data. And then I want us, if we're going to collect the data, it has to be for a purpose and a purpose that's going to benefit the community. The District of Columbia, I've been here most of my life. And the District of Columbia has always been an experiment field. That's what I call it. We have been the place you can come and collect all kinds of data, particularly data about the minorities, about the Black community. And so one of my concerns is let us, you know, the people at the local level, not just collect data just to collect data. Let's try to use it to the benefit of the people who live here, because that's what folk want now. And I think the pandemic has shown us that is so important. You know, this yin and the yang, it has to work as we move forward into the future. So I just wanted to explore it a little more on that note. I do want to ask you, and thank you all for your comments. I really appreciate it. Laura, I wanted to ask you about the mobile food pantries. I think that's an intriguing idea. You heard one of the representatives of one of the villages talk about how frequently it is used and the volume, the tons of food that have gone through the system just makes me wonder, what do you think about that, and how you're going to use this mobile food pantry concept?
Yeah, so these ideas, this type of idea is exactly what we hope to support and kind of generate through our shift in the lead agency model. The focus on socialization hubs, the focus on getting to neighborhoods where maybe we weren't before, and on creative ways to distribute food and to meet the food needs within neighborhoods. We have to try it all. And I think that is part of what we are pushing internally and through our grant funded programs. I know someone earlier said, we need to reach out to the faith community. We're doing that. We are working very closely. Kathy Pointer at Kingdom Care Village is working very closely with pastors in DC about food insecurity. How can we support their members? She actually operates a food pantry out of her church. Everywhere we have supported food programs, people show up. And so to me, what that means is that we need to actually continue being more active, getting out in the community rather than waiting for people to come to us. And that's what we're focused on.
Well, based on your testimony and based on the testimony we've heard all day today, to me, it looks like it's clear that we need this legislation implemented, and that more so, we need to make sure that your office is an integral part of it, and maybe the processor for this program. When you think about 90 different entities across the city that are attempting to address food insecurity, and you've heard from some individuals, even the moms that were started out to address school kids and their families, and now they're also responding to seniors, it tells me that the breadth of the issue is pretty broad, and that having a coordinating point would be very, very beneficial. It's not, in my head, it's not either or, whether it's your agency or DACL, or whether it is this standalone entity that has the likelihood of being created. But I think we have to figure out how we combine the effort. I think that the issue is so mammoth that, and we want to move the District of Columbia from being number one in the country. We don't want that statistic at all. We want to be a state, but we don't want that certificate, and hanging around our neck that this is who you're meeting, the District of Columbia, number one in food insecurity. So we've got to come up with a way to do this. And it seems to me a coordinated effort is our very best bet. And it also gives the public a clear indication as to how we are addressing the issue holistically, and how any funding is devoted to the issue. So, and this is back to Councilmember Che's concern, and that it seems like perhaps maybe we're not hearing loud and clear that DACL is embracing this concept, utilization of a task force with many voices, many representation. But I know that that's not where you are, because I'm sure you've done an analysis of the information as well. So I haven't put words in your mouth, but I'm hoping to move you closer to where I think we really have to be. I mean, we gotta really take this on.
I couldn't agree with you more.
All right.
We definitely have to take this on. I have told all of our grant funded partners, I've told every single member of my staff that we're ending senior hunger. And that's not a pie in the sky dream. It can be a reality, and we all need to be committed to doing that. And so, you know, that has been what has been driving DACL's programmatic, internally and externally expectations this year, and will continue next year and into future years. I absolutely believe that we can end senior hunger in DC, 100%. And it will take all of us doing things that maybe we are uncomfortable with and have never done before in order to do it.
Well, my money is on you. I watch you take on a couple of other projects that, you know, we've discussed over the years since you've been in that in the directorship, and it is working. And at least we know where we are working, and that's a breath of fresh air. So I'm very hopeful that will be the case with this project. And I wanted to ask about the you're going to do a contract. You're contracting with I think you indicated that contracts and procurement is looking at putting solicitation out in the community for you.
That's right. Yes. So actually last summer, this was an idea that we had after talking to some colleagues in different states and, you know, kind of different national organizations, that we really wanted to better understand why DC is #1 in food insecurity. I think I could come up with a list of reasons that make sense to me, but they're intuitive and maybe not actual causally linked. And so we have been working with OCP to develop a solicitation where we can have somebody kind of pull together both the national and local lens for us, and to actually do a more formal canvassing of our network of seniors in the community about food insecurity in DC, and different conceptual ways that we might think about it and attack it. Because as other witnesses have said today, food insecurity is not just about food. There's so many other things that affect food security: transportation, economics, you know, whether or not someone has mobility issues. There are a lot of different things that impact this. So, you know, as you know, we go out in the community quite a bit. We talk to seniors a lot, all the time. We hear from seniors all the time. We listen to the seniors who come and testify at roundtables and at our hearings. But it's not scientific. And so we're really looking for a partner who will do a really critical analysis of what's happening in DC and help compare it to maybe other jurisdictions that are doing better, and figure out what we can learn. Because frankly, it's embarrassing. It's embarrassing that DC is #1 in senior food insecurity. And there's no reason why we should, given all the resources we have, given the support that we have in the community, given this administration support, this council support, there's no reason why we should be here.
And well, thank you for that. And I am therefore assuming that, you know, we're in agreement that gathering this important data, you know, would be informative to not just the current work that you do in the agency, but also to the work of the task force as they are helping to spread the information in all corners of the city and to get more of our seniors with better health outcomes. So I'm expecting that. Does this solicitation come out of the $58 million food access fund, or is that separate?
No, it's separate. The solicitation is going to come from DACL's budget. We are going to be using some of our federal, well, actually, let me get back to you on which pot of funds we're using. But we have set aside some money for studies for this year.
Okay. Well, I would imagine that it would be beneficial. This study would be, if done right, would be beneficial to several other agencies because while we're attacking food insecurity, certainly making sure that everyone who is qualified and in need of the waiver, as an example, would be very helpful, as well as, of course, SNAP, but certainly other kinds of services. When I hear a senior indicate that they have worked in both the federal and the local government and still be short of monies to purchase food, and they talk about just the general cost of living, it is very concerning. So I know that there's a lot of poverty. In fact, I think we're still at the top of the poverty scale in the nation for our seniors. And this should not be. Every year for the last 5 years, the district's budget has increased almost $1 billion. Okay? So how are we really spending that to really get to where people are? And I know that this is such an important issue for DACL. And so I'm really on this, and I'm sure I see Councilmember Shea may still be with us. Maybe she may have.
I am.
Oh, I'm sorry. I didn't realize that. I know sometimes the light is there and the people are not there. I know you may have some additional thoughts. I don't want to take up all the time.
No, I'm ready to wrap it up. Thank you very much. And thank you for having the hearing, and I hope we can get the bill moved quickly.
Yes.
And as some of the witnesses said, and get it funded.
Oh yeah.
Mm-hmm.
Yeah, that's going to take creativity, apparently. But
all those billions you've been
that's
talking
correct.
about, so
That's where I am, council member. Exactly where I am.
Okay.
All right. Director Newland, you have any closing comments you want to add to today's testimony?
Well, I just want to thank the committee, Councilmember Che, for taking senior hunger so seriously. At DACL, we know that senior hunger is closely linked to senior isolation. And those are the two major issues that are confronting not just DC, but this country as a whole. And we really need to get our arms around it. I think that I have no doubt really that we can be the example for other jurisdictions. And so, the mayor is 100% committed to this goal. And as you know, ending senior hunger is really interlinked with a lot of other challenges as well. And so we look forward to working with this committee and with this administration to end senior hunger.
All right, well, we thank you very much. We have a number of questions that relate to the meal delivery program, your in-house program, as well as, record keeping. But I think if you don't mind, we would like to submit these to you and then get, your answers for incorporating in our budget hearings that are coming up, so that will be complete. Unless you would like to chat longer, we can do that.
I'm at your disposal, but adding questions, we will be prepared to answer questions regarding our meals programs at our budget oversight hearing next month.
All right. Okay. Thank you very much. Amelia, can we? Okay. All right.
All right.
All right, I want to thank everyone who participated in today's public hearing for their contributions on improving nutrition services for our seniors. If the public has any additional thoughts and would like to submit written testimony regarding the performance of the, really on this bill, please email it to housing@dccouncil.us and it will be included in the hearing record. Let's see, the committee's next meeting will be on Wednesday, February 16, 2022 at 9:30 a.m. And it will be a roundtable on the nomination of Michael Spencer to the Housing Commission, Rental Housing Commission. And this concludes today's hearing. And with that, the time is 2:29 p.m. on February 14th, 2022, and the meeting is adjourned. Thank you all.